learn and act. Try to see that the things you've learned, you are able to actually issue of sexual rights. We want to discuss more about sexual rights. Who has these rights? Are these rights proportionate to both boys and girls, men and women and young men? Who has more of these rights? Do these rights expose us to any undue challenges? Comes a responsibility. In the university, there are people that have gone through and they never know that challenge in the university, but there are people that have come to the university and never left it. I was in the university in 2004, and a few days ago I met a colleague who has actually never left the university. So, you know, until you meet such a person who has never left the university, of the
From the broad definition of health, according to the World Health Organization, we are talking about your mental health, your physical health, your social health, mental health. It is as wide as that, but in relation to your what? Your sexuality. So I'd like to pick from the International Conference on Population, which occurred in Cairo in 1994, where it is said that, you know, when sexual health is being discussed, we should view it as part of the reproductive health, and it really includes healthy sexual development, equitable and responsible relationships, it should be free of illness, disease, disability. You should be free of violence and other harmful practices related to reproductive health. So it's a wide definition. It ranges from your mentality to what you are thinking to the practices. Do we know of practices, for instance, in Uganda, which relate to our sexuality, which are harmful? Which ones?
Female genital mutilation
is one of them. So, having understood the wide definition of sexuality, what do you think influences, therefore, our sexuality and sexual beings? Our cultures is one of them. The person who gave us the first remark said that also our gender roles, but also our biological sex. Meaning that if you're a boy, you're a girl, you could be different, but that being a girl or boy also can influence your sexuality. The way you are socialized, the way culture has described that these are roles of boys and these are roles of what? Girls in relation to sexuality. For instance, in Uganda, issues of experimentation and exploration are perceived as norms for boys or girls. For which sex? For which gender? For boys. It's okay to run around to experiment and find out what is happening out there. So our social, cultural norms and practices can actually influence our sexuality. But also our environments in which we live. For instance, if you are born around Katanga, you still have Katanga, isn't it? And all its social challenges. You are probably not as protected as somebody from Kasanaluwero in the villages. Your economic challenges. For some students here, they've come with it, but for many, they don't have enough. If you do not have the necessary skills, the low poverty index, your level of economic ability can be an influence things around us which can influence our sexuality. What our religion? can influence your sexuality. Put up your arm so that she can move around. Yes, please. Education, can you explain a little more how it can influence your sexuality?
Educated, they have more skills. Compared to the illiterate people.
They should be. But unfortunately, that may not also completely be true. For many people, education, in fact, has become a challenge because they are now economically and socially what? Empowered.
I wanted out to bring out this aspect of education, as you were saying.
Yes.
Those to bring it. When you look at the past, there was a tendency of grooming these young ladies through sexuality. They could tell them about the dangers, about the relevance, about the because sometimes some be a curse. You go to married when you are virgin. Really, it was some good part of influence to sexuality.
Okay. So, but he's also saying both boys and girls. Is it only the girls who should be groomed into good sexual health and behavior? So we will create a gap for the what? For the boys. And maybe this gap, which we have grown over time now, is catching up with what? So both boys and girls require, because you know sexuality expressed, and the bigger percentage of Uganda, it is between, recognize, of course, sexuality expression can be between same what? Sexes, but the bigger population has now been
the issue of parental guidance. The parents, it's really hard to about issue like this. So it becomes a wider issue.
And home, parents, but also the relatives around, in which you live, and very much so the school within which you spend a lot of time on your sexual health. Another hand. Mike, and as we go through those two, then we shall move on to acknowledging.
Yeah, I don't know. In relation to religion, no, I'm in a different angle. Belonging of belief that there is God and there is Satan, and we know Satan uses armies like Prince. Maybe on the family level line whereby you are demon possessed along that line, I strongly believe it can also influence for both girls and boys.
Thank you very much. It's a very strong point, and you need to read more around it. The usual understanding is our spiritual being, prayerfulness, and it. That's our spirituality, our religiousness, and our prayer. What messages do we get, and how do we therefore subscribe to that brought up in a religious way? And I think you have come across cultures, some practices, not so much East Africa, but they could be hidden. But I think there is a lot in West Africa, if you read that area. Being born a girl and you belong to this particular god, and sacrifices are held around you just because you are born a girl in that family, in a certain line. So there is also that part. Not so common in Uganda, but recognized internationally. There are two hands there.
Thank you very much. I also think the media can influence sexuality, especially the movies we watch, pornography, all that. Thank you.
I think very right. Even the papers which are outside there, which we are reading, and the books we read constantly. So the information coming out of people, visual, audio, is very, very important.
Okay, thank you. Mine is exposure to various kinds of things which can expose our sexuality. I'll connect with my colleague, as she has said, that media. So if we get exposed to things like movies, newspapers, it has widened sexuality in the way that some people have even got exposed to another way of having sex, like male to male and female to male. Female to female. Thank you.
Many minutes. 10 minutes. Okay. Thank you very much. So now we have understood the wide range of issues around our sexuality, what it is, and we acknowledge that it is a normal thing, it is pleasurable, and it can be done whether you have intentions of reproduction, but also without intentions of what? Reproduction, because this is how we are created. An important thing that we need to mention is that within this understanding, therefore, locally and internationally, they are what we know as sexual and reproductive health what? Rights, but also responsibilities. For instance, right now, you are fulfilling your right to information on what? Sexuality. Outside there, you are fulfilling the right to sexual and reproductive health services, isn't it? And for many of you, you still have an opportunity to express your right to select a partner. For many of your colleagues, they didn't have that one. A partner was selected for them. You have a right to select your marital life. You have a right to access and make sure that you're accessing quality sexual and reproductive health services. You have a right to remain without a partner, by the way, isn't it? And it should be your right. Nobody can take it away from you. However, with these rights, we should also know that we have to have certain responsibilities. We've put down a few responsibilities which we young people must have if we are going to ensure our own sexual health. Some of these include, we must ensure that we acquire knowledge about sexuality. That's your responsibility. It is your responsibility to know where sexual and reproductive health services are and use them. It is your responsibility to follow instructions if they are given to you about maybe a condom, about a contraception, about a drug which is going to treat you. And it is your responsibility to make an informed what? Choice. We can say so much, we have informed you, everybody has informed you, and it remains therefore your responsibility in whatever decision you want to undertake around your sexuality. It is, whatever the outcome is, it is your what? Your responsibility. You don't only have rights, but you also have roles and what? Responsibilities. But in life, there are certain skills which we must acquire, which help us do this critical thinking and take the right what? Decisions. I'm sure as you've been growing up, somehow you've been mentored, you have been nurtured, you have been parented to have some critical skills in you which help you overcome some of the sexual challenges which we have mentioned. And the key to this is communication. Are you able to communicate correctly to the various people who need to be communicated to about your sexuality, both verbal and non-verbal? Because for many people, the non-verbal is a huge skill which needs to be gained, but also when you see a person doing certain things, you should be able to read them, even if they have not done anything to you. You must be able to run away when you visualize that this non-verbal communication may next turn into something. So in communication, you have things which are said by people to you, wanted or unwanted, but there are also those non-verbal what? Communications which you must recognize early and say, I don't want them, and be able to take the correct decision and in time. You should have coping skills. We've just talked about a particular session, and I hope we'll have opportunities to do many more like this so that we continue to discuss the environments around our sexuality. Thank you very much for coming.
Round of applause there for Dr. Olive Sentumbwe Mugisa. Thank you so much. It is still the Inter-University Dialogue on Sexuality, and that was fantastic, Dr. Olive. The Q&A, which is quite important. It is a dialogue, so we need to interact, you know? We need to be honest about the questions we have harbored in our minds, so thank you so much. Another round of applause for Dr. Olive. Thank you so much. And before we go on to our next keynote address, if you do have questions, remember, please, you can always write them down in case you think you'll forget, because you'll be having a session later on to actually ask as many questions as you can. First, I'd like to welcome Wilberforce Ojambo, who is the Director of Finance for Reproductive Health Uganda. He's got a few people to introduce us to who have joined us for today's dialogue. That is Wilberforce Ojambo, Director of Finance for Reproductive Health Uganda.
Thank you, Master of Ceremonies. Ladies and gentlemen, I must say you are most welcome to this important dialogue. And on behalf of RHU, I must say that this dialogue is quite timely. I've already been introduced. My name is Wilberforce Ojambo. I work with Reproductive Health Uganda. And we are indeed proud to be associated with this dialogue. My task is going to be simple. I'm here to introduce some important personalities and ministers, some honorable members of parliament, and shortly they will be sharing something with you. But before I do that, I'd like to emphasize that for us as RHU, dialogue is very, very important, and we believe that this way, the best means of empowering our young people is to equip them with the knowledge and information. You need a lot of yourself, both academically, socially, politically, and morally. And I believe that the information that you derive from here should be able to empower you to check on your lifestyles, improve your lifestyles, understand the issues of prevention of sexuality exploitation. Sexual exploitation is a common thing at all universities. I've been in a university, I know what it means. And it's something that we shouldn't allow to happen. So having said that, I would like to introduce some very important personalities and ministers. I will begin by introducing the chairperson of Reproductive Health Uganda, and that is Madam Honorable Sylvia Senabulia. Honorable, please. She's our chairperson for Reproductive Health Uganda and very, very much passionate about sexuality education. Of course, our ministers, we also have Honorable Mulindo Patrick. Are you there, Honorable? Please, you're most welcome. We are also honored to have Honorable Flavia Kabahenda. Where are you? There she is. Okay. Yeah. Thanks so much. So having said that, I'm going to request and invite our chairperson for Reproductive Health Uganda, Honorable Sylvia Senabulia. She will be sharing with us something about sexuality education. And later on, she will invite the other MPs to share with us the same about sexuality education. Please, Honorable.
Thank you very much, Mr. Odiambo. All protocols observed, ladies and gentlemen. I've been taken unawares because when I look at the program, I think I was supposed to give closing remarks at the end. But I want to say personally, as a person and also as the chairperson of Reproductive Health Uganda, the issues to do with sexual and reproductive health are issues that are close to my heart. The issues that I'm so passionate about, both as a chairperson, as a person, as a member of parliament. So I can, when I'm given an opportunity to talk, I can talk and talk non-stop. And when it comes to adolescent health, Dr. Olive knows because she was my supervisor at some point. So she knows that when I was doing my research, I chose a subject of adolescent reproductive health. But for now, I know my colleagues, members of parliament, may not be able to be with us for the whole of today. And what I want to say before I invite them to say something is that in Parliament, we have a very powerful group of members of Parliament who are passionate about health, specifically reproductive and maternal health, and have done a lot of work to influence government policy and legislation and budgeting towards the areas of reproductive health, and mainly maternal, newborn child health, and adolescent health. So that's why, despite the fact that many are busy campaigning, but they could take off some time from their busy schedules to come and be with you in this dialogue. They may not be able to be with us for the whole of today, so I want to invite them. Let me begin by inviting Honorable Flavia Kabahenda, Member of Parliament for Chengegwa District, and also the Chairperson of the Committee on Trade and Industry in the Parliament of Uganda. Honorable Flavia Kabahenda.
Thank you very much, Honorable Chair. I will not say my name again, but I'm the Member of Parliament for Chengegwa District, the Chairperson of the Committee on Tourism, Trade and Industry, Parliament of Uganda, and the Chairperson for the Parliamentary Forum on Social Protection. And I know that social protection does not end only with the money that goes to the older persons in terms of SAGE, but social protection for all Ugandans and humanity as such. I am another passionate person about sexuality and reproductive health, and I think I'm not a discussant on any of the topics that are going to be here. I just wanted to come here and really be part and participate with you on this dialogue and find out whether the age group that we are dialoguing with is eager, keen, active, and that they are following what is really going on around us. I was a university student sometime. I know what it means when we talk about sexuality, especially at this level of education where people think they are now independent, they now are thinkers, they now can make choices, they can determine their destiny until they find themselves determining their deaths instead of the destiny. So I just wanted to come and participate with you and really enjoy the way you discuss issues about your own life, because sexuality and reproductive health is life itself. That is where we derive life from, and that is where life can be ended. So I really don't want to preempt any discussant about this, but to assure you that the Parliament of Uganda is not sleeping over sexuality and reproductive health. We are very cognizant of the issues around sexuality. We are able to stand and submit and advocate to the effect that the government of Uganda provides not only the budget, but also the environment that allows dialogues, that allows protection, that allows spaces, money, and everything that is required for us to be sexually protected, for us to have reproductive health, and for us to really deliver life in a way that gives life to both the deliverer and the delivered. And that is why we always emphasize that whoever is giving life must remain with the life, because in most cases we deliver life and we lose our own. So I would like to assure you that we are not here to really disturb or interfere, but we are here to watch and find out whether at this age group, at this level of education, we are moving at par, and whether we can stand in Parliament and advocate for what you want, or possibly we are talking to ourselves. I thank you, Madam Chair. I thank all the organizers. I thank all the facilitators in terms of funding and also knowledge. Dr. Olive, I'm glad to have shared your presentation, and I think for the time I'll be here, I'll be very glad to share the other presentations. Thank you very much.
Thank you very much, Honorable Flavia. I think in the interest of time, other members of Parliament will be engaged as we move on. And I'm glad that they are here with us for most of the day to hear and share with the young people. Thank you so much.
Thank you so much. I'd like to call for our next keynote address, and this one will be having an overview of the role that is played by academic institutions in nurturing sexual behavior and health outcomes of young people in Uganda today. Please welcome Professor Edward Chirumira, Principal, College of Humanities and Social Sciences here at Makerere University. That is Professor Edward Chirumira. Welcome. In the interest of time for the Q&As, we'll do that later on, so you'll be delivering your address. Thank you.
Thank you very much, the Lady of Ceremony, the Chairperson of Reproductive Health Uganda, honorable members of Parliament, my colleague, keynote speaker, all protocol observed, ladies and gentlemen, especially the young people for whom we are gathering here today. First, I would like to appreciate the opportunity that Reproductive Health Uganda is giving me to say a bit on the role of academic institutions, or generally higher education institutions. Thank you very much for that opportunity. Before I make my remarks, I also want to acknowledge that Reproductive Health Uganda, or by then Family Planning Association of Uganda, has had a bit of a significant contribution on my professional growth. When I finished my second degree master's some time back, the first international assignment that I had was to support family planning associations in Africa, and the base was the Family Planning Association of Uganda. So that gave me a chance not only to be exposed to sort of community level engagement with sexuality and reproductive health, but also gave me a chance to do a bit of work around Africa. And because of that experience between 1989 to about 1996, I had the opportunity and honor to visit and to work in country in almost all African countries. So for that, I really appreciate the support that I was given by International Planned Parenthood Federation. A lot of times we academics stay in our institutions, and perhaps that link with government, with NGOs, may not be as much as possible. So for that, I appreciate that I was given opportunity earlier on to think in the context of the wider environment. And so my reflection is going to be in that particular context. And so if you have any problems with Reproductive Health Uganda in terms of its regionalization, Chairperson, know that the culprits was Professor Chirumira and Henry Barrow, because previously it was just one solid centralized organization, and we proposed that it is regionalized, and I'm happy that that regional operation of Reproductive Health Uganda made some impact, because the problem was that, you know, formal family planning work in Uganda started in 1954, and, you know, for up to, you know, the late 80s, early 90s, we're still having, you know, Dr. Sentumbe would know, we're still operating at 24%, you know, family planning use. And perhaps one of the reasons was that, you know, it was very much a central thing, a Kampala thing. And so regionalizing makes people feel that they're part and parcel of this. And so again, when we're talking about the role played by academic institutions, I think we again called on to say that this should not be just a Makerere University thing, but higher education institutions working in tandem. Because right now we have more than 35 universities in Uganda. And so if we're talking about young people in higher education institutions, increasingly Makerere University has less and less percentage of these young people in the university. And so I think the starting point when we look at the role of academic institutions in nurturing sexual behavior should be the inter-university collaboration, the extent to which universities can speak to each other, and therefore giving the young people the confidence that they are young people, but they are not those ones who went to Makerere, and those ones who went to Nkumba, and those ones who went wherever. So the call that I will start with is in line with the theme that we are having today of inter-university dialogue. And so in that way, Makerere University is only providing the launch pad or the forum that will support a truly inter-university dialogue. And perhaps, Madam Chair, this is where we may want to interface with the Inter-University Council and the higher and the Council for Higher Education, so that these are active players in making sure that we integrate sexual behavior and sexual and reproductive health in our workings as we are. Having said that, there are about 3 levels. First of all, I would like again to join Olive in reflecting a bit on sexuality and reproductive health. And I would like to suggest, and I hope that this is one of the messages that we can take, that sexuality is not equal to sex. When we talk about sexuality, we are not talking about sex. I remember the last inter-university dialogue we had here, one of the young people said, don't talk to us about sex, because we are beyond that. Yeah? We already are okay with sex. Talk to us about how we can have safe sex, or talk to us about how we appreciate sex. And I think, in a way, I remember that one of the panelists then was rather shocked. But on the other hand, we can take advantage of that the young people are beyond sex, but they are concerned on how they can live sex. And when you talk about living, you know, looking at the lived experience, then you're beginning to talk about how can we appreciate it, how can we experience it, and how can we live it in a manner that is not detrimental to us. And so we get into the area of sexuality, so that then it's all about, it's a much more richer engagement than just simply saying, you know, how do I get there? And it becomes one of those things that qualifies you to be a university student. One of the comments that was said was about the freedom that one has here, and that freedom should allow us to experience sexuality rather than to experiment with sex, because these are two different things. And unless one appreciates the entirety of sexuality, that's when you can actually enjoy sex. But otherwise, if you start from the other end, from the outcome, then you're going to have a very, very big problem. And so two things tend to qualify people when they come to universities. It's having the smartphone and also having sex, unfortunately. Both of them are not necessarily good if they are seen as independent of the context within which they can be understood, okay? So the same thing with reproductive health. Again, we have to look at reproductive health in broader terms more than just looking at the childbearing. Because sometimes we think that if we can make the health centers good, if we can make the labor ward fine, then we have addressed reproductive health. But as you know, that reproductive health starts from when people begin to think about childbearing. And that's very early on. So you're going to think in terms, and to think in terms of the behavior, in terms of what you would want to be, and therefore what facilities one needs in that. And so if we look at both sexuality and reproductive health from that broader perspective, then higher education institutions begin to have a role to play. But if it is seen as sex, then definitely higher education institutions would not have a role to say. Now, going to the role of the academic institutions in nurturing sexual behavior, again, one makes a note that higher education institutions receive young people at an average age of 19, or at an average age of 19, 20. So a lot of damage is already done. And so the role of higher education institutions needs to start with the extent to which the higher education institutions are linked with the secondary education institutions. Because if we wait for the young people to come to Makerere University, to Mbarara University of Science and Technology, sometimes it's already too late. And so I think there's need to have that particular linkage. And one of the ways, of course, is given that higher education institutions are the ones training the teachers for the secondary schools, then investment in the schools of education, in the higher education institutions, become critical. What are the programs? What is it that we're teaching the teachers who are going to teach the young people in secondary schools before they come to universities? So that is one area where we need to look at the programs and the teaching methodologies that we have in the schools of education in higher education institutions. Because that way, we will produce people that will help us to engage with the young people when they're still teenagers, before they come to university. So that's a challenge to us as institutions to see that we produce people that can help us to begin to nurture sexual behavior at a much lower age than to wait to engage these young people at this level. So one of the pillars of the universities is teaching and learning, and so the role that we need to play there is to see that the programs we have in the universities are competence-based. They're developing competencies, not only in the teachers of teachers, but also in ourselves as lecturers, but I think most importantly for the young people that are part of these programs. So there is a challenge there for us as universities to review our curricula in a way that the young people that are taking our programs are provided with competencies for sexuality and reproductive health related behavior, as it were. The second thing is that we as higher education institutions do play a critical role in this nurturing of sexual behavior by providing evidence. We are a research institutions, we innovate. So both research and innovation presents an opportunity for academic institutions in the direction of nurturing sexual behavior and health outcomes. And there are a few products that are coming out of universities. If you look at Dr. Musazi's Makapad, if you look at the research on sexuality that is coming from the School of Public Health, you look at the research that is coming from the College of Humanities and Social Sciences on behaviors, on changing cultures and so forth. I think this needs to be harnessed in such a way. I think what we need also to do is to have our young people involved in this research and innovative role of the university so that they are part and parcel. They ask the questions for which higher education institutions can provide answers or evidence in this particular respect. One of the things that one looks at when you're looking at nurturing behaviors and outcomes is the aspect of mentorship, and it's also the aspect of role models. If you ask the young people who is their role model as far as sexuality is concerned, sometimes you'll be surprised who they come up with. And so higher education institutions have the responsibility of providing mentorship for young people. It also has the responsibility of providing role models so that people can say, oh, we can look up to so and so. It is possible for us to have a rich, reproductive health experience because we can look at somebody. Chairperson and members of Parliament, the issue of role models is becoming very critical. The role models we have these days, I'm sure you know. I do not have any problem with celebrities, but those are the role models that we are having that are going to shape sexuality and reproductive health outcomes of the young people. So, but the celebrities, some of them are being trained in higher education institutions. So we should not blame the celebrities. We probably should blame the people that are training them. And that is a higher education institution. In my college, I have the Department of Performing Arts and Film. It trains most of these celebrities. So if we started in the higher education institutions in inculcating competencies and positive sexuality and reproductive health attitudes in these celebrities who are going to be the role models, then I think we've contributed in a way as higher education institutions to the whole aspect of sexuality and reproductive health. So it's a joint effort. So it's who are the people that the young people listen to, and how can we bring this into the fold of these higher education institutions and be partners, so that then we can shape that process. The other role that higher education institutions can play is, I've looked at, and I think all of you have received this, Reproductive Health Uganda has a number of upcoming certificate courses. And this is replicated by other NGOs. They have short certificate courses, they have short research projects that they do. And so the role that we can play is to build the capacity of these organizations and put content in these short courses. And so again here, I'm happy that Reproductive Health Uganda is partnering with us, especially with the College of Humanities and Social Sciences. And this is one way that we can have, we can input content in your courses, and perhaps even go to an extent where these courses are co-offered. So you have a course that has Reproductive Health Uganda, Makerere University. Or you have a course certificate that has Reproductive Health Uganda, Mbarara University of Science and Technology. And the young person will feel that, you know, there's substance in this, certificate course, and will be encouraged to be now a role model for the rest of the young people. So there is a lot that higher education institutions can do. What we need to do is to reorient and perhaps have both a mind shift and sort of a paradigm shift, if you will, where we ask higher education institutions to relate to the broader community problems. Universities originally were set up for two things. One, to populate the civil service after independence. Secondly, to train academics that will now replace the Europeans that were in the universities. I think we've moved on. University is no longer about training for the civil service, it's no longer about training academics. And so we have now an opportunity of having higher education institutions engaged in topical issues. And sexuality and reproductive health is one of the things. I'm glad, of course, to report that Makerere University has a sexuality policy, and that's a very, very big step forward. We have also established anti-sexual harassment committees at all colleges, and the schools are being requested also to set up anti-sexual harassment. So this is a very good effort, but also it is at the tail end when sexual harassment has happened. Now what we need to do as higher education institutions is to engage in the process of preventing that. And so prevention, as I said, then gets into the engagement with the civil society, with Parliament, and a number of players, so that Makerere University and other universities are part and parcel of this. And so as we move forward, it would be nice that as we move forward, we have members of other universities and higher education institutions engaged in this kind of debate, and also for Parliament and government to engage the Inter-University Council, the Council for Higher Education, to begin as part of their reviewing of the programs that are offered in universities, to begin to review them in the context of to what extent are they building competencies. And one of the competencies is for people to have positive sexuality and reproductive health behaviors in this particular respect. And this is possible. This is something that we can do, to say that, for example, you have a cross-cutting course in all universities. So whether you are an engineer or you're a medical doctor, or you do a module in sexual and reproductive health. People can go on and do their masters or their PhDs, but at least everybody has a dose, like what we are doing now about communication skills and gender studies. So sexual and reproductive health can very easily be one of those cross-cutting courses, and we look forward to that particular engagement. So as I conclude, I would again like to appreciate and also to say that universities have the capacity. A lot of times we are in a comfort zone. And what I would like is to request you out there to ask the questions, to say, what is it that you want your higher education institutions to do? and make sure that you follow it up, because otherwise, any person within the university, as long as they do their research and they have their publications and they get published, they are fine. But it's a public university, and we're here because of the public. And so the public needs now to ask for accountability. It would be very difficult for me to ask accountability of myself. But if you ask accountability for me to justify why I'm here, then we work together to make sure that academic institutions are expected and should be part of nurturing sexual behavior and health outcomes of young people in Uganda. And I think it's something that we cannot afford not to do. Because now when you look at the percentage representation of young people of the Ugandan population, if you take, for example, by age 24 or 25, you're talking about 70% of the Ugandan population. So, sexuality and reproductive health is a huge thing. And we need, as universities and as other players, to engage in this process. So I do hope that I've provided a bit of some pointers that we can begin to have a conversation between academic institutions and non-government organizations, public and so forth, in nurturing sexual behavior and health outcomes. This must be a partnership, this must be a joint venture, because we have the students here for 17 weeks, then we lose them for the holidays, then they come back, we have them for 17 weeks, and that's it. So we actually have them for 32 weeks of the entire year. And a lot of times we expected to change them within those 32 weeks times 3. And that is a very little time for the duration that we have these young people. But I think, again, we have the opportunity that we can provide mentorship. We can also provide role models. So we should start by checking ourselves as university members of staff and say, how are we behaving? So that then young people would want to behave like the way we do. So thank you very much for this opportunity. And I do hope that together we can nurture sexual behavior and health outcomes of young people, but starting from listening to the young people themselves. What are their problems? What are their concerns? What are their worries? And all those things. Unless we know what they're experiencing and going through, we cannot fix it. It will be simply social engineering, which will not get there. I know that increasingly parents are having a challenge of listening to their young people. Actually, parents are fearing their young people. And so they always get surprised by the outcomes. They are not engaged in the behavior formation. And so this is the same thing that should apply to higher education institutions, that we engage in behavior formation rather than setting up systems that punish outcomes. Thank you very much.
Thank you so much. A principal at the College of Humanities and Social Sciences here in Makerere, that is Professor Edward Chirumira. Thank you so much. I can see the numbers have grown, so for those who just joined in, welcome. It is the Inter-University Dialogue on Sexuality. Thank you so much. Professor, I'll let you. A round of applause for Professor Edward Chirumira there. And he did say that the young people need to ask questions, otherwise they wouldn't know how to help you if you don't ask questions. So that moment is about to come. My name is Flavia Tumusime. I'm your host for this day, and I'm not alone. I'd like to welcome a media profession. He's a television programmer, a consultant in media, telling you where the breakaway sessions will be in case you want to attend any of them, what topics they'll be covering so you know where to actually selectively go. Please welcome Anthony Itwara.
Thank you, Flavia. And I will not take time. We are going to be having the breakaway sessions, and these are going to be 3. One is going to be here, another one outside, and the other one is going to be at the main hall common room. And of course, I will give you information on what we will be discussing in those breakaway sessions, and you will choose which topic is of your interest. We have people, panelists, who are going to be discussing in these different breakaway sessions, and the first breakaway session is going to be on gender. Gender. How many men are in the house? Yes, I can see the men. Some of them are not sure. I think that is the reason we are here. You can understand your sexuality and know whether you are a man or a woman. But why I asked is there's something here. There's some kind of insinuation here in this dialogue, breakaway session 1, where they say they will be discussing male-based dominion and ignorance of rights. Some insinuation that you people, men, don't know your rights, and somehow that is affecting, is a key factor in the spread of HIV and AIDS. Do you agree or you don't? If you don't agree and you feel that you should be part of this kind of breakaway session, you will be requested to go to the common room, and this breakaway session is going to be moderated by James Tumusime. So if you're a man and a woman and you agree with that, you can actually go there and also give your opinion. We'll be discussing stereotypes, gender-based violence and rights in the universities. The next breakaway session is going to be out on my left in the tents, and it is going to be moderated by Flavia Tumusime. And it's going to be talking about contraceptives. You know, these, I'm sure ladies are more friendly with contraceptives than men. Am I right? Sorry? You don't agree? You agree? You are indifferent? Okay. Okay, if you are interested in that discussion, you'll be moving outside there, as will be contextualizing and personalization of contraception and contraceptives. We'll be also showcasing various contraceptives. You need to go out there and see which one works for you, especially men. Now, the last breakaway session is going to be here, and we are going to be talking about something that comes after an act of lack of information, knowledge, preparedness, which is called abortion. I want to believe that by the time you choose to abort, something went wrong. Do you agree? Yes. So if you want to discuss that, you will remain here and I will be your moderator for that breakaway session. We had planned to have a breakaway session for about 2 hours, but in the interest of time, we're going to make them a little more short, 1 hour. So I would request members to take positions in where your interest is for the contraception outside, and for those who are going to be discussing gender-based violence and rights in universities, you go to the university common room, which is you go out there and you go on your right, you find the common room. Thank you very much. I will not give that much. I will also read out some of the people who are going to be taking part in these different breakaway sessions. Breakaway session on gender, Dr. Peace Musimenta, lecturer and researcher at School of Women and Gender Studies, Makerere University. You'll be in that session. And basically, that is Dr. Musimenta. You will be going to the other session, which is in the Makerere main hall, common room. Now, breakout session 2, where we're going to be talking about contraception, we'll have Mulumba Moses, the Executive Director of CHURD. You'll also be joining Flavia in that session. And the one that is going to be here on abortion, I expect to have Joy Asasira, Center for Health, Human Rights and Development, Diana Nanyange, SRHR Alliance, Uganda, Dr. Rashid Gulaba, that is Makerere University Business School, Health Center, Harriet Kamashanyu, Let Girls Decide, Jackson Chekweku, Reproductive Health Uganda, and Dr. Okello Samuel Moses, Uganda Health Marketing Group, Uganda Management Institute. Those ones will remain here for the discussion on abortion. So, ladies and gentlemen, I request you to take your seats, but if you like, you stay.
Well, so just to recap for everyone, there's a tent outside, and that is a session on contraceptives. The keynote speaker should be Mariam Mugambi, who's a service provider with the Bwai Youth Center Clinic. So that session on contraceptives, you head on the side outside, there's a tent. For those going to the common room, you'll be discussing gender, stereotypes, and gender-based violence, and also rights in the universities. Dr. Peace Musimenta, I think, has already made her way to the common room. If you stay in the hall, your discussion is on abortion. The moderator will be Anthony, and Anthony will be joined by Joy Asasira, who's from the Center for Health, Human Rights and Development. You'll also have Diane Nanyange from Sexual Reproductive Health, and also Harriet Kamashanyu from Let Girls Decide. So you just have about maximum 2 minutes for us to make our way to our respective breakaway sessions. So once again, in this room, if you stay, you'll be joining the session on abortion. If you go outside on the side, there's a tent. The discussion is on contraceptives. I'll be there to moderate that for you. In the common room with Dr. Musimenta, you'll be discussing gender-based violence and stereotypes on male-based dominions. So just the 2 minutes have already started. Make your way to your respective breakaway sessions. Of course, later on we'll be back and we'll continue with our inter-university dialogue.
For those of you who will stay here, I'll request you to come closer and let's talk about this abortion thing. Members of the panel, I would have loved you to come up this side, but I can see, since we are going to be a few, I will come down. Okay. Those ones sitting at the back, please come closer. because I need to give you the mic when you want to talk. And I don't want to move that side when there is space here. She's not yet here. Diana Nanyange, you're welcome. Dr. Rashid Guloba, not here. Harriet Kashanyu. Harriet Kashanyu. Jackson is not here. And Dr. Okelo Samuel Moses, you're around. Thank you for coming. Okay, Exodus video is ready. We're going to start this session with a video. After that, we'll have a keynote address as we start our discussion with Moses Mulumba, the Executive Director for Center for Health, Human Rights and Development. Okay. That video will play as we go along. Now, this time I call upon Mr. Mulumba Moses to come and give a keynote speech as we're going to be discussing abortion in perspective, perceptions and policies, insights into Ministry of Health, guidelines on reduction of maternal mortality due to unsafe abortions in Uganda.
Hey, mommy, oh, hey, mommy. Mama, God, the pain is too much. Hey, mommy, oh, hey, mommy. Mama, God, the pain is too much. Hey, mommy.
Good morning, everyone. I think we have already had a very good start in the morning, and my role is simply to introduce quite a number of aspects that we need to think about when discussing the subject of abortion. I want to thank Reproductive Health Uganda and other partners that have made this possible, and also for giving me the opportunity to speak to the group. But most importantly, I think I want to thank the morning panel that has opened up the discussions that we need to think through. In my keynote, I will start with a very personal story and how I lived abortion, and probably discuss policy framework which have led eventually to the production of the standards and guidelines which are very critical today in Uganda on the topics of access to safe and legal abortion. I've seen a copy of the standards and guidelines have been distributed, which are, I think, critical for this day. On a personal story, I grew up in a home with a mother that is a nurse. This mother of mine was working in a private facility, non-for-profit, but also ran her own clinic. And I keep saying that the experiences of women coming into this facility that have gone through the bad abortions and needing treatment are still fresh in my mind. But I also noted very generally that it was not just the treatment interventions that the women needed when they had actually gone through the unsafe abortion, but there were other things. They brought babies to the facility, but all the time the women came to the facility, it was clear that it's the women and not the men. I know another panel is discussing this. And the question always comes up when you are discussing questions of abortion, where does the man run to? There is a lot of misinformation. There is a lot of non-action on the part of the man. And in most cases, when these cases become bad, it becomes the issue of the woman. And I think we need to handle that, not just as a woman's issue, but also begin to recognize the roles of the men that they need to play. Again, when you closely look at the general statistics of maternal mortality, as Dr. Sentumbwe has presented, we continue to emphasize that the questions of child delivery, whether at the time of giving birth or at the time of the pregnancy itself, they have still remained, my local language, that whole process is called Olutalo Lw'Abakyala. Literally meaning it's a battle for the women. So for me, this keeps disturbing me, and when I continue to look at the statistics that are coming up, I think we need to begin thinking, and especially as the youth and the people at the university, it becomes extremely, extremely important that we think about this subject as a very critical subject. I have grown into a lawyer and a practitioner in health law and policy. And every single day, I have to interact with some of these very bad statistics that do happen. When you look at the government documents themselves, they emphasize that actually out of the total maternal mortality, 26% of that is preventable maternal death from unsafe abortions. So if we dealt away with the 26% of the maternal death, we would actually comfortably achieve the old Millennium Development Goals. So it's a critical issue that I think we need to tackle. When you look at the total of induced abortions themselves, again, the statistics indicate that you have annually 297,000 induced abortions happening annually in Uganda. If you did a quick calculation of this, and I've seen it in the papers, you have 800 abortions that are induced every day. So as we speak today, 800 abortions are going to happen. But out of this, many of them end up being complicated and therefore call for treatment interventions that will deal with the intervention. And again, statistics indicate that almost 85,000 women in Uganda every year have to go through this kind of treatment. It's not actually cheap treatment that you want to think about. It costs the economy, it costs the women themselves, but it also costs the health system itself. Because if you're to spend the amount of dollars that are spent in just this treatment, which is about $14 million on post-abortion care annually in Uganda, I think this would deal a lot with a number of other things that would have been dealt with if we had the opportunity to control the abortions and we don't reach at the extent where the abortions have gone bad. Some of the health professionals we've worked with have continuously talked about these horrible statistics. And the most famous one, Dr. Chigundu, always asks, if this situation was affecting men, would it really be a problem? Wouldn't men quickly come up and fix it? And maybe the problem is because the challenge is for women, the men are quite less concerned about what needs to happen. Every single day we have to deal with cases from underchild age girls that have become pregnant as a result of rape, as a result of defilement. We have a very interesting case where a young girl went to a facility and she was actually defiled by a person that was working in a lab, and she conceived. 14 years of age, it was terrible for her, and she kept being tossed up and down, where the health professionals told her she had to go to the police to get permission in order to have the pregnancy terminated. Now, when she went to the police told her she had to go to the health professionals to get permission to have the termination happen. So it's this confusing situation that sometimes puts our underage girls, even those that are above the age, not knowing what to do when they eventually get pregnant and they end up in performing very terrible abortions. We also have a series of doctors and midwives that we have got out of police cells. And what usually happens is that the moment they suspect that the victim that has died in your facility was purportedly procuring an abortion, you are arrested and taken to Central Police Station, and the Bukede will be called immediately. And the next night you will be on Agatari Konfu. Unfortunately, many of the cases where we have got the health professionals out of police custody, they are actually providing what they call post-abortion care. The woman started the abortion, but the abortion went bad and she visited the facility, and the health worker has to provide the care. Now, when you continue arresting these health professionals, it becomes extremely unfortunate, and many of them are shying away from providing the facility. We also currently have a nurse in one of the districts who actually provided medicine which a woman inserted into her, and because she did not receive enough information, things went bad. So she went before the police and then eventually was taken in custody, and when she was given police bond, she took off. She doesn't even pick calls at the moment. So the situation is that bad, and the question has always been, what's the problem? What's the problem? How do we deal with this problem? Part of the problem may be in the public health system and the setting, but as lawyers, we are also finding a huge problem in the current legal framework, which I think we need to address. When you ask people, what does the law on abortion say? We don't have time to answer that. Many of you will say abortions are illegal, and whoever undertakes an abortion is carrying out something that is illegal. Our Constitution under Article 22 clearly says no person has the right to terminate the life of an unborn child except as may be authorized by law. That provision, if you simply read it, you will get so many interpretations. What I can tell you is that when the constitutional provision says something cannot be done except as permitted by law, it requires that our members of parliament and whoever is responsible has to come up and provide a law under which that action can be done. Unfortunately, to date, we have never got a law because our constitution is 1995. What have we resorted to? We have gone into the Penal Code Act, which is spelling out offenses. Our Penal Code Act is a 1950 legislation. It introduces offenses against any person who assists a woman, against any person who provides anything to a woman who is going to carry out an abortion, but it also creates offenses against the woman who does the abortion. Remember, the Penal Code Act is 1950 and the Constitution is 1995. So we still have that gap. But luckily, we've recently had a court judgment where we sued the government on a very old legislation on mental disability, and we are calling women that had been defiled and raped as imbeciles. The justices have said that any law that was passed prior to the Constitution must be brought in conformity with the Constitution. What this means is that the Penal Code has to be revised at the moment to treat that challenge. But the Penal Code provision also has a very interesting section which clearly says that a person is not criminally responsible for performing in good faith and with reasonable care and skill a surgical operation upon any person for his or her benefit or upon an unborn child for the preservation of the mother the mother's life if the performance is done reasonably and you have taken care of the mother's state. It's a very long provision and very vague. It focuses on terminations that can happen, but it also calls to the fact that you must be reasonable in carrying out this. All these have not yet been tested. But one can conclude that maybe it's one provision that would be beneficial for the health professionals when they actually come up and carry out the terminations of pregnancy in good faith. We still believe that a lot has to be done. The Ministry of Health has moved a step further in realizing that the current legal framework is not helpful. It has tried to develop a number of policies. And these policies are beginning to tackle the questions of when an abortion can be terminated. When you look at the 2006 National Policy Guidelines and Service Standards for Sexual and Reproductive Health, the ministry provides that access to abortion services can happen in a number of instances. And some of these include severe mental illness, if you have a severe fetal abnormality, if you have cervical cancer, if the woman is HIV positive and requests for a termination, and if there has been rape, incest, or defilement. But the ministry puts an italic and says this provision is subject to the current law. So while it's a good provision, I think we really need to clear the current legal framework on termination of pregnancy. But the ministry, again, has come up and developed what we are calling the standards and guidelines for reducing mobility and mortality from unsafe abortions, copies that have been provided. These guidelines are supposed to be assisting stakeholders in decision making, and they prescribe a range of generally acceptable approaches for achieving the provisions that are put in the standards and guidelines. For the university students, they emphasize the youth-friendly services, and they clearly state that these services should be confidential and there should be counseling and information that is provided. The guidelines do not just focus on termination of pregnancy, but they also focus on other measures that are very critical on ensuring that there is prevention and management of pregnancy. As the title says, they provide for both standards and guidelines. And the standards are literally the minimum requirement that should be met by all facilities and health workers. And should anyone deviate from that, it becomes an issue of violation. On the other hand, the guidelines within the document provides for generally acceptable approaches for achieving these standards. So one can easily conclude that I think the Ministry of Health is moving much faster than the legal practitioners, including Parliament. I'm glad we have members of Parliament here. We really need to come up and help. The statistics are continuing to make a case that people have instances when pregnancies can be terminated. The questions of moralization, the questions of culturalization, and religiosization of termination of pregnancy are not helping in any way, but rather catalyzing the severe abnormalities that are resulting from the terminations of pregnancy. My hope would be that out of this dialogue, we begin to give opinions and options that will help shape the discussion on termination of pregnancy, not just from the religious or moral perspective as we have always done, but from a more public health, more considerate perspective that will see a future where no woman dies or gets disabled in the course of performing their natural maternal function. But also as the youth, we do believe that there is a critical role that you can continue to play in shaping the health system and making the health system more accountable and supporting women while observing their rights and choices that can be done. I believe that that should be enough to spark the discussions for the panel. Thank you very much.
Thank you very much, Mr. Mulumba. With that, keynote address on abortion. Now, allow me to invite my panelists up here, such that we can start the discussion. Joy Asasra, not around. Diana Nanyange, please come up. Harriet Kamashanyu. Dr. Kelo Samuel Moses. Connie, please come up. Okay. And there is a video I want to play first, but because of time, I am going to play it later. As we start our discussion, dialogue. Diana, yes, I will start with you. You see, the legal issues, Mr. Mlomba has explained what the law says and what happens with the Constitution about abortion. You work with the sexual reproductive health and rights. Do we have a right to abort?
In Uganda right now, there's the abortion law says that someone can abort under some medical, if they're suffering some medical conditions or complications with a pregnancy. So that's when they can abort. Though I don't think it's, the law really caters for people who get pregnant when they don't intend to. And we've seen that Uganda, almost half of the pregnancies that we have, 38% are unintended. So if 38% of pregnancies are unintended and abortion is illegal, most people will end up having unsafe abortion. And having unintended pregnancy rides us back to the fact of having enough contraceptives available for young people, because we're talking about young people at university. So if they're not able to access these contraceptives, then they'll end up getting pregnant without, when they don't want to, and they'll end up aborting due to the laws we have in Uganda.
Okay, if someone does something that they don't want to do, wouldn't that be their own responsibility to do it? Is abortion right, in your own opinion?
In my opinion, abortion is wrong.
It's wrong, yes? Tell us.
Totally wrong. But one thing that we have to understand, there are circumstances under which somebody goes for an abortion. By the time somebody goes for an abortion, it is unplanned pregnancy.
Yes.
Unless medical terms or medical circumstances dictate so. It could be planned, then somebody goes for an abortion, but that is the medical side of it.
So which abortion is not right?
Abortion which is not right, all abortion is wrong, but some abortion is right as far as medical terms are concerned.
Okay.
For example, if it's threatening to the parent's life or something like that, they may say go for it. But looking at higher institutions of learning, it is wrong. It comes as a result of unplanned pregnancy.
So abortion due to unplanned pregnancy is wrong. Do you agree?
Yeah, I think I'll strongly agree. Actually, we are called Let Girls Lead, and we strongly work with teenage girls. And this is one of the key issues that we've been dealing with. Apart from the medical issues that might come along or give the right reasons of aborting, we also have rape cases. When you look at the different spheres of Uganda, unfortunately this is happening in Kampala, though most of these cases of teenage pregnancies are in the rural settings. So I'm imagining issues of maybe rape or the early marriages, and something happens and the girl is taken back to their respective families, she still wants to go back to school. What happens then? We've heard from him talking about the legal framework around this, but we still think we need to come up with a mechanism of catering for such issues that come along, giving us a genuine reason of carrying out abortion. Yeah.
Okay. Dr. Umar Rashid, do you think girls should decide when to abort and when not to?
Okay. The Constitution, I'm becoming a lawyer now. It gives 4 provisions under which abortions can be legal. I think someone could help me cross-check. The very first provision is if from at least 2 doctors independently decide that this pregnancy is exposing the mother to risk, especially the kind of risk that would terminate the mother's life. Like if the baby, like an illustration I could give is if someone has eclampsia, someone is pregnant and they are convulsing, their blood pressures are very high, and that can lead to the death of the mother. So if 2 doctors independently decide that this pregnancy should be terminated because the mother's life is at risk, the law provides that that pregnancy can be legally terminated. The second provision is in situations of incest. We all know what incest is. So if someone is pregnant and it's because the father impregnated her, the law provides that that pregnancy can be terminated. So abortion can be legally carried out then. The third is which one is the third? The third is rape. Now that one is difficult to prove because someone can allege I was raped, yet the sex was consensual. So that one is a little bit difficult to prove, but the law also provides that if someone is raped and there is clear proof that there was rape, the sex wasn't consensual, then abortion can be what? Procured legally. The fourth one, which is shady, because I think the law is not in line with the current medical advancements, says if the mother is HIV positive. But we well know that with the advancement of medicine and how HIV can be treated, that being an HIV positive mother does not mean that you're going to get an HIV positive baby. So under those 4 provisions, I think someone who is pregnant and needs to abort, they can follow the law and an abortion can be procured.
You come from let the girls decide. And I asked, should we let the girls decide when to abort and when not to?
Should we let girls decide? It's tricky. I think girls should decide when to get pregnant or when not to get pregnant.
Okay. You think they should decide?
Actually, I think he answered it so well. It's the girl should decide when to get pregnant, not when to abort.
Okay. Sebo. Dr. Okel Samuel from Uganda Health Marketing. Now, girls should decide when they should get pregnant or not, but they shouldn't decide when they can abort. Is that right?
Thank you very much. First of all, I would like to say that explanation is right in our own opinion, but I think it's fundamentally flawed in the sense that abortion is one of the issues that is shrouded with many dimensions. One of such is there's a religious dimension to it, cultural, political, and there are also issues to do with the society's perception, the moral aspect of it. For me, I think when you talk about health...
Where do you stand, you as a person?
I am coming there. As somebody, as a public health person, we are looking at the right to decide when not to have or have abortion in a more unidirectional way. When you talk about health, it's a fundamental outlook to an individual. You look at the mental, the physical, the social, the aspects of a human being. So if you get to a point where you are pregnant and it affects your economic well-being, your social status, you're dropping out of school, you are physically not ready for it, you're underage, 12 years, 14, and so forth, and your health is at risk, the decision should not be handed to society. That decision should be handed to the individual who at that point is the owner of the life, to take the decision that this is not right for me.
Well said. I am sure you're clapping because it was well said, not because it was right. Okay, now you've made it very clear, but I want to ask Connie, if you want the ladies to have the audacity to take a decision whether they should keep it or not, shouldn't they also be able to take a decision whether they should indulge in sex or not before they can say, I'll have sex and then have a choice to have it or not? Connie.
Okay, I think we need to first of all do a reality check. The truth is, majority of today's girls engage in sexual intercourse at a very early age. That is true.
Yes.
Then we need also to know that most of these girls, especially high school and higher institutions of learning, have more than one partner. One who does coursework.
Is it true? Okay.
One who does coursework. One who takes them out for kedanke somewhere, I hear float, and one who meets the bills.
Okay.
And also, some of them use contraceptives. They are knowledgeable, they do know. And others use it wrongly.
Okay.
So we need to get back to a drawing board. When to get pregnant and when not to get pregnant.
Yeah.
I think it comes with redefinition of who you are.
So you have gone to the moral perspective.
We need to understand who are you. And that is where we are failing, or that's where girls are failing. The moment somebody comes into university, it's like, katandi kabutandi, it is the way to go.
Yes. Why not?
Forgetting all the package that we came with from home. So we need to get back to the drawing board, redefine who you are. What are your values?
Okay. Thank you, Connie. We are putting abortion in perspective. We want to be able to find out, do we have to abort, or we can avoid it, or we can evade it, or actually if we have to, what should we do to have safe abortions? I want to ask you, Dr. Okello.
I'm Harriet.
No, I'm saying Dr. Okello gave us a good perspective. How abortion is looked at a society level, at a religion, faith, law. I want to ask you, by the time we choose to abort, and quote my words, choosing, what is at play at that time? What is at play? What are we basing on to choose to abort?
I think it's what we started with initially when we talked of the various reasons that give someone the consent to go ahead and do abortion. In my experience, working with the different girls, some of the reasons are what he talked about, like maybe incest or rape. And I, as a person, I still feel it's a leverage of this girl terminating the pregnancy and having a way forward, not only for herself, but the future that lies ahead of her. So, I am a Christian, and I'm not saying I'm sabotaging what the pastor or the religious different people that are standing on when they talk about abortion. But we also need to look at reality. We are even redefining it as self-abortion. Now, these are things we never used to talk about as we grew up. But we are now bringing plus things like self-abortion because we know these things are happening and they need a mechanism that we need. So
Just because I have a future, I have a society to fit in, does it give me a right to terminate another life for my well-being?
Dr. Okello shared earlier, and I think if a young girl is not socially able, mentally able to raise that child, financially able, because getting pregnant also takes a lot of finances, then if they're in a situation where they really can't afford it, socially they'll be outcasted because they're pregnant and they'll drop out of school. So if all those scenarios are put to reality.
Pass the mic to Omar Rashid. What you people are explaining, and you looking at only one person forgetting the other.
Yeah, they are forgetting.
The girl will get out of school, the society will look at her.
The first person who is most concerned is the unborn child.
Yes.
I think the child has rights. If you consider the child to be a person, maybe, I don't know at what, at different ages. There are those who tell you above 12 weeks, that is 3 months old and no tampering. But below 3 months, then you take care of all the finances. In most cases, you find the girl will not abort. Forget the part played by the one responsible for the pregnancy.
Now,
no, we should. Because abortion is with the perspective from with a girl, if a girl aborts, she could die. She could die. That's why it's not good to abort.
so he is saying, because of the danger that might be involved. So if we make abortion safe, it's okay, right?
It's not fine still.
Okay. He says it's not fine still. Let me start from here. Safe abortions, they should be provided. But to who? That's the question.
To those who need, because if we say safe abortion should be provided,
okay.
So if she has weighed the consequences, then she should have.
We leave this girl to decide that I have weighed my options. If I give birth, I will get out of school. Shouldn't we give this responsibility of deciding when to abort to another? I mean, in the first place, by the time they got pregnant, in an unwanted, keeping other factors constant, they couldn't decide.
I'm going to give you 2 scenarios. I'm a health worker, and I want to give two situations. A young girl in a very good school, and I won't say more because you may guess the school, who is very much loved in quotes, and always it is the father taking her back to school, and the mother never accompanies the girl to school. And sometimes the girl used to be picked by the father. And almost every year for 3 consecutive years was pregnant by the father. Scenario 1. This is a real story. You could have read it in the papers. For those of you who have lived many years like me. The second story, again, is very similar. But this is an uncle of a girl brought from the village to come and stay with uncle to go in a good school again. And on the first occasion, the girl reported to this clinic named X, saying that she's bleeding, and definitely she was bleeding profusely. And the uncle apparently around her asking the midwife, who is my friend, please do everything, I'll give you everything you'd like, my child is dying. And she didn't really investigate. Then the second time, she really wanted to put the girl aside to say, last time you came like this, what is the problem? And you're in school. Girls finding themselves to have. But I also gave you the statistics that 50% of the girls aged 15 to 24, their first sexual experience was the rape. And some of these rapes result into unwanted what? Pregnancy. Okay. I think that is what say.
I get your point.
You see what both.
Okay. There is that scenario where you're young, you're 15, and the circumstances are taking you there, and you have nothing to do. You guys are university students. Some of you are 20, some of you are 19. Some of you are the one they said the first experience is rape, but it is rape with your boyfriend, and you don't intend to be raped, but you just don't know how to accept. So, finally, you accept, and then you get pregnant. And then you can't finish your university. You decide to abort. Do you think it is right, madam?
I don't think advocate for safe abortions, because whether we believe it or not, abortions are happening.
Since we have rapists, we should provide girls for them. Because after all, the girls are being raped. Is that what you mean? Do you think it is true? Or it is right?
I think she's right.
That what?
Other than having those aunts, like people having abortions which are not safe, we rather put it like at larger by if you can have a safe abortion, you can go for it, rather than going for herbs and then people end up dying.
Let me ask one lady first. Which one is easier? Which one is easier? To have a safe abortion or to protect yourself for a pregnancy?
To protect yourself, but sometimes it happens when you don't expect, but that's why the people just engage themselves in abortion. But to some extent, I think a safe abortion should be given.
Okay. What are the guys saying? You guys, you are the ones who impregnate these girls?
I think when we talk about rights, every right has a responsibility. So you have a right to have sex, but you should be able to look at the responsibilities that come with sex. I think that's where the discussion should start from. We shouldn't go ahead of that without telling people of what they are going to engage in. So if I'm going to have sex, then I should be ready to handle the responsibility that comes with that. Then we also have to settle the issue of life. Is the fetus in the womb a baby? Is it a person? Does it have life? I think then when we settle the issue of the fetus having life, then really we can move also ahead with the discussion.
Okay.
Then let me finish a little bit. If then that fetus is life, then I'm being selfish to say I have a career, then I have to destroy this life for my life to go ahead. I'm just being selfish with myself. I think 1 year many people have had rebounds in school that has not killed their careers. Many people have been sick that has not killed their careers. I think a life can be maintained so long as we know it is a life. Then the last one would be, can we justify one wrong with the other? Already you've done a mistake, good. Maybe a mistake has happened, like the lady has explained with the relative or whoever. Do we have to justify that wrong with another wrong?
Okay.
Is that really?
That's a very good question. Now, Dr. Kell, don't you think that people, despite the fact that there are some cases which are even permitted by the law, do you think that some people are just hiding in that to go for a blanket safe abortion?
Thank you very much. I think, first of all, I would like to say that Uganda is one of the countries where at least the law permits that in case the mother's life is at risk, then the abortion is expressly given as the option of treatment. So for me, I don't want to hide my head in the sand. Facts speak for themselves. 16 women die every day in Uganda to pregnancy-related complications, 4 of which are due to unsafe abortion. If you say 6,000 women are dying, 1,200 of them, that is the equivalent of 12 of these halls due to unsafe abortion. So we can choose to window dress this the way we want, but the reality is that unless as society we have made the decision that in Uganda it is not yet right or worth to save the life of 1,200 women who die every year due to unsafe abortion, then as a country we are letting down this category of women.
Doctor, I will still remain with you. These people seem to be interested in the way you put up the points, but let me ask you the same thing.
Yes.
You're saying 1,200 died due to unsafe abortion, but that's just 4% of women who die, right? He said 4 people. Said, give me the statistics again. 4 out of where?
It is 26% if you put it in percentage.
Okay, 26% are dying due to unsafe abortions. The other 74% is still dying due to
the other complications of
the other complications of pregnancy.
Could be infections, could be...
So is it right to direct the efforts and the monies to providing safe abortion if we have failed to provide a safe environment for a pregnancy?
I think let's look at a holistic approach to health. And in terms of health systems strengthening, which is one of the things we need to be focusing on. One, we need to look at what even, and I want to bring this discussion to these guidelines, that these guidelines provide 2 avenues upon which we should not let down the women of this country. Avenue number 1 is that we should not allow somebody who is not prepared to get pregnant to get to that point. That means the religious leaders, your families, the society should provide for all the options. That means contraception should be available. The unmet need for family planning should be addressed. And we should be educating young people on when to delay the first sexual contact. We should also be telling religious leaders to preach being faithful. So once we set out one section, that is prevention. If we fail to do that, we have let the women of this country once. Now, there is no contraceptive method which is 100% foolproof. There are tendencies, if you don't use it correctly, that you will get pregnant. That's the fact of life. So again, if you reach that point where even you who has been using a condom gets pregnant and you're not prepared mentally, physically, and socially, we should also provide you with the 2 exit routes. One, in this guideline, they say foster parents can be arranged for you to adopt that child and help you cope. Society should do that. But also, there are people who may not even have a foster. What should they do? Should they be condemned to the reality of the health situation? So again, we should offer them a safe out route. That means we should not allow them to conduct unsafe abortion. And I will give you examples. And this is what is done. There are women in villages who will take buckets of herbs to abort. They insert sticks into their birth canal to abort. They flush the birth canal with jig to abort. Some people even use soda, this Coca-Cola you drink, to flush the system. They even tell people to stand on their tummies and put pressure until they can abort. Why should you go through all that when we have a competent health system? So we should provide that outlet. If we fail to do that, we have let the women of this country twice. Now, the final option is that we should, as people working in the health fraternity, provide a safe environment whereby if you want to carry out an abortion, one, it should be in a safe place. No infection. It should be at least in a conducive environment, privacy, and all that. Again, as policymakers, as people working in this healthcare system, if you can fail to provide the minimum requirements stated by WHO, minimum, not even the extreme, we've let the women of this country thrive. So these guidelines is an attempt from the health fraternity to provide a premise upon which the legal frameworks can be formulated. This guideline is ahead of the law, so the law should come and converge with these guidelines and provide an avenue upon which we can coexist and prevent the death of the 1,200 women that happens every year due to unsafe abortion.
Okay. You have answered me, but in a very long answer. Of course, it is with the information. Pass the mic to Connie. I got lost somewhere because the facts Yes. The facts were too much for me. But thank you very much for those. For terms, I asked the question, which, with the background of that information, I expected a direct answer. In Uganda already, maternal mortality is high. Okay? So, should we be putting efforts on safe abortions than helping young mothers who are willing to produce, giving them the care they deserve to have safe pregnancy and birth? Because that's just 26% of what is happening. Can't we devise other ways of reducing unsafe abortions? That was my question. But now you answered. I'm sure you gave me the answer along the way. Connie, abortion is happening, whether safe or not safe. What do you think should be done to reduce either safe or unsafe abortion?
I think safe or unsafe abortion, it is a reality. But I think we need to do more of a preventive kind of measure. How do we prevent, in the first place, pregnancy? Because abortion is happening, it's true. Safe or unsafe, it is true. But we need to get back to sexuality education. Many of the people get pregnant because they are ignorant. Ignorant. Because, and the many, because I usually speak to young people. Recently, I went to have a talk at a high school, a career talk. And this young lady told me that she was pregnant. They had gone for a farewell, and this young boy told her, they're all in the same class, S6.
They're old.
And you're 6. They're still young at
They're
that
18,
level. Okay?
they're old.
And after some time, she told the boy that I am pregnant. The boy comfortably said, nze sizala till 30. Now this girl came to ask, what should I do? The boy says he's not ready to be a father till 30 years of age.
Then foster father.
Foster father comes in. But we need to do more of education. How do we prevent it? People are ignorant about the means of preventing it. And this is where we need to get back. And I want to really concur with Professor Chirumira. Can we get back to the people concerned to revise the curriculum? Whereby sexual education is a right to anybody in school and not in school.
Pass the mic. Do you really think that girls are getting pregnant because they don't know that there is a condom somewhere? They don't know that having sex will get them pregnant? Is that true?
I would not say it's true or it's not, but I would say there are different percentages. Yes, the level of ignorance is very, very high in some areas, and in other spheres, maybe like Kampala, people are really informed. They know how to go about it. Maybe they even work with the condoms within their different bags, but something happens and at some point you're forced into this. Then maybe I also want to go a little back to the question that you are asking Dr. Okello. Looking at the different spheres, these are factors that make up society. We look at families, we look at the religious entities, we look at the educational backgrounds and all these. So I think this is a factor that is not made up of only one component, but there are very different stakeholders that need to come on board in addressing this. So one might be ignorance, like she is saying. Another might be maybe family background. Some of us grew up without, maybe you only have nannies. I mean, what else are you supposed to do apart from watching stuff and learning from media? There is no person to tell you what to do. In this current generation, we actually listen more from our peers than even the parents and maybe the teachers. So that means if my friend or my peer has misguiding information, I'm most likely going to take the same path. So it goes back to sexuality, the different teachings or the different sexual education facilities in schools where peer education is key. Who is this right-hand person that is going to help you go all the way? Because most of the parents and most of the key stakeholders, we expect to stand in the gap and no longer playing their role. Thank you so much.
Thank you. My mic is out down there. I want to ask, we are talking to university students. We want to put abortion in perspective, and we are looking at the challenges, challenging assumptions and rethinking safe abortion care services for young people in public and private facilities. But we're also looking at unsafe abortions in higher institutions of learning. It is true that there are young people, there are those age of 10, 15, 12, being unfortunate and getting pregnant, and definitely would recommend a safe abortion. But these are old, these are mature girls and boys. I don't want to think that there is anyone in our midst from any university here who doesn't know that a condom exists. Is there anyone? Yeah? Let me ask, is there anyone in our midst of the young people who is not sexually active? Is there anyone in our midst who is not sexually active? I can see only one. Okay, two. Pass the mic to one of them. Why are you not active when the rest of these people are active? Why?
Okay, the reason as to why some of us are not sexually active is because we grew up from families that were always prohibiting those things.
Okay.
And when we talk about, like, some people don't know condoms, it's because our parents are so harsh when you talk about such matters when you're in family.
Okay.
And when you go back to the cause of abortion, in sociology, there is a perspective called control theory. They say, if you lack self-control in yourself, you're going to be led into deviance. You're going to become deviant. And then you have got also the environment, kinds of people and the kinds of situations. For the kinds of people, we talk about what the parents teach us towards sexuality. Some of our parents, you find them they fall victims of this stuff. So when you talk about abortion, you should first go to talk to our parents who just torture us when we talk about these things. They don't want to give us sexual education. So how can you impregnate a babe and then she's like, you're responsible for the pregnancy and then your father is going to hang you when you reach home? So first talk to the parents before you come to us, we, the victims of abortion. Thank you very much.
Okay, still with the mic. I like your point to talk to the parents first. But you also say that you are inactive because of your background.
Yes.
So it is not by choice.
It's not by choice. But if I was active, at least I would have gone somewhere and proposed for marriage.
Okay.
Yeah, not this illegal sex we are always having in bufundas.
Okay, so let me ask.
Yeah.
You don't know things about sex?
Sex?
Yes.
50-50.
You know. Wow, okay. Pass the mic to a lady in front of you. That one. That one. Please pick the mic. And I am asking you, you are sexually active.
Yes.
Do you actually understand? What? where you are. Stand up a little bit. Yes. Do you have all the information about sex for you to be active?
Not really.
Are you ready to get pregnant?
Yes.
Wow. Pass the mic to the gentleman in front. In front. Sebo, you are sexually active.
Yes, please.
With a girl who doesn't know what they are doing, or they know what they are doing?
Actually, they know what they are doing.
So are you ready to be a father?
Yes.
Okay. Pass to the lady next to you. You are also sexually active, right?
Yes.
Do you know everything and anything about sex?
Not really.
But you know enough to have sex?
Yes.
Okay. So, I'll come back. No. Now you can see. This is 99.9%. These people are sexually active and they know what they are doing. And when we are putting abortion, safe abortion in perspective, let's look at these people. These people who have made a choice to have sex. Okay? Let's not look at the ones in the village or the younger ones who don't know what it is, but these people know. And you people, and for instance, Dr. Okello, you want us to allocate money to help them abort when they went for sex, when they knew exactly what they wanted.
Thank you very much. I think either 5 years ago, there was a study done in Makerere University. And it was discovered that in Makerere University, the girls fear to get pregnant than even to contract HIV. Pregnancy for them is more dreaded than actually the risk of getting HIV. The same study was done in Gulu University. It shows that female students in institutions like these, I'm now not talking about anything below the university, they dread to get pregnant. So I don't want us to take the populist yes. Individuals seated there are actually living in, they are telling you lies. Because if one of them got pregnant, most likely, they will not have tuition for next semester. There was a story of one university, like this one here. A girl got pregnant and she was expelled. We all know what happened. So if you have such a society, you can't even go to the nitty-gritties, because for me, I want to speak from facts. If one was expelled in that university, I'm sure there are many who would not even talk about pregnancy in that institution. So you can see the realities of our society.
Well, so it is very true that most of you are lying. You wouldn't get pregnant while you are here. And yet you are having sex. Seriously. Like there's no tomorrow. Yet there is tomorrow when you get pregnant. So I know we can talk about this, and I'm going to give you time to talk about it. This is just an icebreaker. We're going to talk about this in detail. We're going to find out if you are active, are you having safe sex or not? We're also going to find out what do you mean by saying you are sexually active. All that is going to be coming up in our main dialogue, which is going to happen after lunch. We're going to find out, we're going to understand the real sexuality bit. What makes you to be a girl? That sexuality word, me, I like the word, the first three letters, sex. And guess what? Sex is nice and is good and it is enjoyable, but only to people like us who are mature, who are willing to take responsibility and have got the right to have it I will come back to ask Diana whether there is also a right to have sex and who has that right. Because you people say you have a right, but I don't agree, in my own opinion. I'll close this session at this time, but we're going to continue with this discussion in our next session, where we'll be looking at the key roles played by families, schools, media, and other communities in promoting and empowering positive sexuality. We're going to find out what is positive sexuality and negative sexuality. We're also going to find out sexual health empowerment. They're going to, because in my simple definition, sexual health means having healthy sex. So we're going to find out how are they going to empower us as young people, but also we're going to find out whether actually what you're having is healthy as sexual health. And also we're also going to talk about the uptake of sexual health services. How many of you visit clinics to find out whether you're okay? I mean, to find out whether you're having the right number of days in your periods. How many just go there to have a checkup? How many of you are going there to ask for the right method to prevent you from either pregnancy or STIs? So how many of you are accessing these services, and why are you not accessing them? We're going to be discussing all that after we come back, and I want to thank my panel for this discussion, for the insightful information that you have given us, and for your contribution. Thank you very much, and clap for yourself, please. And our next on agenda, we're going to have what we call a condom bash outside there. You want to know what it is? Just get out. After you've seen, lunch will be ready for you. You see, and go for lunch. After lunch, I'll be right here to discuss more on sexuality. Thank you very much. My name is Anthony Itwara.
Don't know everything, but I'll be alright. My head's on the water, I'm breathing fine. You're crazy and I'm out of my mind. 'Cause all of me loves all of you. Love you curves and all the edges. All your perfect imperfections. Give your heart to me. I give my heart to you. too. Even when you're crying, you're beautiful too. The world is beating you down and around to every mood. You're my downfall, you're my muse, my worst distraction, my rhythm and blues. I can't stop singing, it's ringing in my head for you. My head's under water, but I'm waiting to find you. Love your curves and all your edges. All my eyes, you, you're my beginning. Even when I lose, I'm winning. Excuse me, pretty, pretty, pretty lady. Nice to meet you, my name is Jamaica. Excuse me, pretty, pretty lady. Nice to meet you, my name. Excuse me, pretty, pretty, pretty lady. Nice to meet you, my name is Jamaica. The devil said you move right around my way. My eyes been blessed by the beauty girl, and I just wanna know, do you have a man? Shouting for you, and I have plans. Here's my number, let me know if you're interested. There's a girl in my neighborhood. Everybody wants her and I want her too. But I too much sister, I'm too much watchy. I'm trying to get to her, but everybody's watching. There's a girl in my neighborhood. Everybody wants her and I want her too. But I too much sister, one touch, one kiss, one you is like the perfect love song. What you always wanna hear. With my days going on wrong, you is like the song in my ear. So all I need is you, baby. Body to body with only you, baby. I don't need another. 'Cause baby, what we got a perfect love song. Just the way you look by me when you see me. And the way you put it by me when you give me. I saw me love when the fire blaze, you see me. Now I'm gonna see me roam round like I'm a gypsy. You're like a piece to a pot, queen to a king, bullet to a gun. What they got in common is they all belong together. And it's made me realize that loving you is like a perfect love song that you always wanna hear. And when my days going on wrong, you is like the song in my ear. Woman, there's something you should know. Woman, there's something you should know. A million, one in a million, girl. I will never ever give you up for another. I'll never ever give you up for another. You should know that you're one in a million. One in a million, girl. And I will never ever give you up for another. I'll never ever give you up for another. Alright then, hey. Woman, I pay them no mind, cause they can't stop this. Now they want us to fail, we gonna rock this. The love that we share is our best. The world is ours for the taking. Some of them go and talk, cause when you think them off my head, you've got my heart. Are you right on, I share my bed, and after all the things I've said, I'm gonna put you on the pedestal and hold your head, because you are one in a million, man. One in a million, girl, and I will never ever give you up for another. I'll never ever give you up for Love like I've never loved you. never seen. Love like I've never loved. Hold me like I've never been before.
Baby girl, you are my heart, so man, you infiltrate my soul. Anchoring my love and have the keys to open doors. I'm giving you my all like I've never did before. Girl, the loving way you give is genuine and secure. I never really seen it coming, you hit me like a nail. Loving is all I need, you are the wind inside my sail. I'm giving you everything down to the smallest detail. Girl, I'm never giving up because the love will never fail.
Privacy sounds. It's not infatuation or love at first sight. It's not to my imagination what I feel inside for you. It's not a high school crush, oh no, or puppy love. It's real hard to describe, so the best words I can find to say it. What we have is better than love to me, baby. Inevitably, forever we're meant to be. My love, what we have is better than love to me, baby. Inevitably, forever we're meant to be.
Look here. It's a Valentine affair, baby. BPM volume 16. I told you 2014 is gonna be different. We're taking it to the next level. Supremacy songs.
This whole world I've been around. Something special in you I found. You lift me up when I am down. You make it easy. Easy to love you, baby. You make it easy. Easy to love you, baby. Girl, I know you must be getting tired of the same old lie. So listen to me, trust I ain't never gonna waste your time. But every emotion's bust whenever you cross my mind. See, I thought I'd seen it all before, but you got something that I can't deny. Baby, I've been up and down. This whole world I've been around. Something special in you I found. You lift me up when I am down. You make it easy. Easy to love you, baby. You make it easy. Easy to
Oh man, this one gets me in the mood. Simon, you got to bring that back from the top one more time. BPM volume 16, baby. Valentine affair. Simple, Simon.
I can tell you there's no place you couldn't go. Just put your hand in the glass and let it shine.
supremacy sounds.
When your legs don't work like they used to before. When your legs don't work. When your legs don't work like they used to before. When your legs don't work like they used to before. I can't sweep you off of your feet. Where your mouth still remember the taste of my love. Where your eyes still smile from your cheeks. And darling, I will be loving you till we're 70. Whoa, baby, my heart will still for less. On at 23, and I'm thinking about how people fall in love in mysterious ways. Maybe just a touch of a hand. Oh yeah, me I fall in love with you every single day, and I just wanna tell you I am running out. Take me into your loving arms. Kiss me under the light of a thousand stars. Place your hand on my beating heart. I'm thinking out loud. Maybe we found love right where we are. When my hair's all but gone and my memory fades, and the crowd don't remember my name. Whoa, when my hands don't play the strings the same way, I know you used to love me the same. Country that me call me on, down in East Africa. Kingston, yeah, what you come take now? Come back home. Ever since we met, no need for running. You cool me down, girl, and time is a wasting. Whenever you're not around, look like you cool
7th June 2015. Perth, Adelaide, Melbourne, and Sydney. Get ready for straight fire. For more info, check out supremacysounds.com.
Beats per month with Supremacy Sounds, DJ Simple Simon at the turntables.
Supremacy Sounds Mix.
Oh man, I'm like a kite, still I can roll a split with me eyes shut tight. Oh man, I'm like a kite. Oh man, I'm like a kite, still I can roll a split with me eyes shut tight. Pretty girl, she said I'm on point. She like what me like and she love my type. Said she want ride on my bike. Said she want give it up without putting up a fight. Everything run good in the night till the police surface and I shine them light. Me say, now me make me roll it. Now me make me roll it, Mr. Officer. Now me make me smoke it. Now me make me smoke it. Jamaican them a ganja man. When they see me with the preset speed, if you know man a ganja man. Indica strain on me brain, and no listen what me saying. I'm a real ganja man. No cocaine on me mind frame. Me a tell you this, me a ganja man. Ha! Telling me a ganja man.
Simple Simon.
Long time I studied that television, listen to one messages, I read it in the Genesis. The service of one medicine, it boosts me like adrenaline. Can't stop me this spit, and them must me like a oxygen. Ah! Cigarette noise, my God. Cigarette noise. I don't mean to be a pessimist, this politicians prejudice, cause can't them fit treasure it, cause Jamaica can benefit. Oh me, oh my, high grade herb, yes I need it in my life. Oh me, oh my, I be steaming all night to see the red in my eyes. I'm a ganja man. I just steam these trees when I'm touching on the streets. I'm a ganja man. I got a fever OG and a fever of please. I'm a ganja man.
Sounds, DJ Simple Simon. Follow DJ Simple Simon on Twitter at DJ Simon. That's DJ S I. Yes, Simon on Snapchat. That's DJ SIMPLES Simon. Or log on to supremacysounds.com.
Keep things live. I'm gone, so gone. See me have a feel of what's going on. But the fat girl them up in a the line. Me and them a party till a early man. Because ganja we smoke, me puff it up till I'm on two. But man not take no cool. Get life on a dog, so me not put me brain pan dog. Listen me no look. Ganja me smoke, such I eat more than diamond gold. So me know me not sell me soul. All a good bad, but you know we big bad and bold. But the bang bang.
No share them grades with no meat eater. Yeah, cause me chalice fight me steamer. Herb on the board, cut it with the 3-star. That make me fly, it a musty pizza. The group is a gaba, make it split sweeter. Push herb, make your paper burn like Easter. Yard man a bun junk, so we don't need straw. We draw, gaba lift man head like Caesar. Okay, nobody come here with your crop pipe. Steamer stop like me on a top flight. Space, swell, peace, was fight. Yeah, I read, stop like you know me frost right. Your gun bush weed make hunger chop tripe. You smoke chalice and drop poof, so stop tripe. When they cover act like a dodgy pot light. 4th generation, I tell them bad man no share them grades with no meat eater. Can't touch me chalice, fight me steamer. Herb on the board, cut it with the 3-star. That make me fly, it a musty visa. The group is a gaba, make it split sweeter. Push herb, make your paper burn like Easter. Yard man no bun junk, so we don't need straw. We draw, gaba lift one head like
Supremacy
Caesar.
Sounds.
I said, don't you worry. Good family and good friends. Yeah, everything is gonna be alright. Don't ask for, not beg, Lord, it hurt them. Good family and good friends. God bless them, protect them. Well, I know when negative I go, when bad mind I go, move them up. Them can't turn around yourself. Hey, me no, me tell you no. Me no no time for your waste. What do you? Oh yes, dealing with progress. No stress, can't get me. Them can't curse, jobless. From your health and strength, don't you worry. Good family and good friends. Yeah, everything is gonna be alright. They have a life, sweet life. Lord, it hurt them. Good family and good friends. Jobless them. Tell them how we run road, you know. Tell them how we run road, you know. We run road. Ask any bus driver. We run road. Ask any cab driver. We run road. Tell them how we run road, you know. We run road. Tell them how we run road, you know. We run road. Ask any white line. We run road. All patrol can tell you say we run road. But the same office, so this year him no cross. That's Alliance Bar, scheme and see fast. Red wine me up a pour in a me glass. And me chain them the brass. Me hot no pepper sauce. Me side alkaline, I hide behind mask. Logo in a shots. It up on her. I grade me smoke, the doc no smoke grass. Every reload they pass, I hail me as boss. Tell them how we run road, you know. How we run road. Tell them how we run road, you know. How we run road. Ask any bus driver. How we run road. Ask any cab driver. How we run road. Tell them how we run road, you know. How we run road. Tell them how we run road, you know. How we run road. Ask any white line. How we run road. All patrol can tell you say that.
Right now, cherish my love. Put the better. Cherish my love. While I'm living, do not cherish my love. Some one gone, one gone, but cherish my love. Never pass leave my eyes up wide. Night I come to the that's where them come to. If you look good, girl, on the side, and it's a man, and that's a
Me no beg friend, me no beg weed dog, me no beg blem. If me no beg 9, no me fi beg 10. We have the one money, yeah, me friend let's spend. Cause we no take talk, better send a text then. So anywhere we walk, charge if we set trend. So anymore when we make, we say we no regret them. Make talk, say them no like we. Who the hell cares? Who the hell cares? Them no like we. Who the hell cares? Cup in the ear to my haters, cheers. Bad man, cheers. Envious, cheers. Lustful, cheers. God the trust, cheers. Them no like we. Who the hell cares? DJ Simple Simon. Yo, me living it, me living it, we living it, I'm living it. They pan a top to a look and them a look up, super class. Set a cat in them way back, we and some Colombian niggas a link up. When you look and move the whole gang in a top, drink and a smoke, and we happy. We flipping it, we flipping it up. Me and me top man friend, and we living it up. Money pull up in a me pocket, no up in a me hand. Rich at 21 billion, you're at 30 man. So much bread, I make the fish slice me. I'm the piece I didn't done yet, me a coffee and another one. The pan top a climb and the top of where I am. But the film reads up with friends, some other man text on. In a New York, me buy a girl phone number for your grand. None of time for Instagram, ask me more from kilograms. Living it, we living it, we living it, I'm living it. The pan a top floor, I look and them a look up, look back class. Set a cat in them way back, we and some Colombian niggas a link up. When you look and you move the whole gang in a top, drink and a smoke, and we happy. We flipping it, we flipping it up. Me and me top man friend, them we living it. Anything them go slap round, they clap round, they knock round, they. Everything get flat round, the police a stop round, the people a black round, they. When the choir them clap round, they. Them know them not fi play with this code already. Them know something run like cranberry. Everything them go clap round, the picture snap round, they. Them put it on Snapchat round, they dance like Creech when he sitting them a whistle. Any boy try this is so dull and a missing. Circle them ends for the whole bicycle, and somebody 3 point missing. Ha ha. Artist Lord Whistle, Jamaican gangster on your bicycle. Jordan, skull at a damn pickle. People a slide and the ground don't sipple. When the thing them go slap round, they clap round, they knock round, they. Everything get flat round, the police a stop round, the people a black round, they. When the choir them clap round, they. Them know them not fi play with this code already. Them know something run like cranberry. Everything them go clap round, the picture snap round, they. Them put it on Snapchat. Unruly. Bad we bad, no grab. When you see me start stutter, mad me mad. Drive by for them Benz with a taxi cab. And send boy go home, go ask the God. Ask for what? If me no bad fi bad, cause him sell me life like scrap metal. Ask for walk round with
www.supremacysounds.com.
I live the life I deserve. Bless. If they care, I feel better at work. I mean whatever it's worth, I give whatever I'm worth. For my nigga who gon' go to hell and back for me, I'ma give him heaven on earth for a hell of a check.
You are watching.
Right now, cherish my love. While I'm living, do cherish my love. Some say as one gone, one gone, but you better cherish my love. Never pass sleep, my eyes up wide. Night I come to the you see where them come to. If you little girl on the side, and it's a man, and I see she need love too. When you die, everybody come again. But when you was alive, there's nobody to run to. Family know what to see up on the front too. Fake friend round the back and them upon you. Say you have it and no matter if you share none. Your name never hear them. Show your bust in the sky like a flare gun. Them a hope and a pray your career done. Cherish my love. Who no better cherish No other wait till Monday and gone. No come and they go be a wife up. Right now, cherish my love. While I'm living, you don't cherish my love. Some say as one gone, but you better cherish my love. And we say star, we don't care where it's preaching. Me black, we don't care who bleaching. Get on you to be retired and leeching. Be a back with a lot of girl G. Place that and we got the key. Tell you about them and me got the easy. Them wants to the fall of the real thing. Me a beat them but it's a real thing. Me a fulfill like prophecy. Like Stevie Wonder them casting me. Dead and gone, none of me strategy. All my enemies know me a prodigy. Cherish my love. Who better cherish my love? No other wait till Monday and gone. No come and they go be a white house. Right now, cherish my love. While I'm living, do cherish my love. Some say as one gone, but who better cherish my love?
Talk say them no like when who the hell cares? Who the hell cares? Them no like when who the hell cares? Nothing of the year to my haters. Bad mind, envious, lustful, that bitch up. Them no like when who the hell cares? Who the hell cares? Alright then. Next to me no beg them, me no beg paper, me no beg friend, me no beg weed dogs, me no beg blem. If me no beg 9, no me fi beg 10. We have to want money, yeah me friendly let's spend. Cause we no take talk, better send not text them. So anywhere we walk, charge if we set trend. So anymore but we make, we say we no regret them. Make talk, say them no like we. Who the hell cares? Who the hell cares? Them no like we. Who the hell cares? Nothing of the year to my haters. Bad mind, envious, lustful, that bitch up. Them no like we. Who the hell cares? Yo, when it, living it, living it. The pan top to a look and them a look up, them a look up. Look back class, set a cat in them way back. We and some Colombian niggas a link up. When you look and move the world, gang in a dog, gang in a back, drink and a smoke, and we happy. Flipping it up. Me and me top man friend, them we living it up. Money pull up in a me pocket, not up in a me hand. Rich at 21 billion, you're at 30 man. So much bread, I make the fish slice me. I'm the piece I didn't done yet, and me a go be another one. The pan top a climb and the top of where I am. But the tell me reach up, we friend some other man text one. In a New York, me buy a girl phone number for your grand. None time for Instagram, ask me more some kilograms. Living it. The pan top to a look and them a look up, look back class. Set a cat in them way back. We and some Colombian niggas a link up. When you look and move the world, gang in a dog, gang in a back, drink and a smoke, and we happy. Flipping it up. Me and me that man friend, them we living it. Anything them go flat round the clap round the knock round the. Everything get flat round the. Police a stop round the, people a black round the. When the choir them clap round the. Them know them not fi play with this code already. Them know something run like cranberry. Everything them go clap round the, picture snap round the. Them put it on Snapchat round the. Dance like Creech when he sitting them a whistle. Any boy try to see so dull and a missing. Circle them ends on a whole bicycle. And somebody 3 pint missing. Artist Lord whistle. Jamaican gangster on your bicycle. Jordan, skull hotter than pickle. People a slide and the ground don't sickle. When the thing them go slap round the, clap round the, knock round the. Everything get flat round the. Police a stop round the, people a black round the. When the choir them clap round the. Them know them not fi play with this code already. Them know something run like cranberry. Everything them go clap round the, picture snap round the. Them put it on Snapchat. Unruly. Bad we bad, no back, no grab. When you see me start stutter, mad me mad. Drive by on them Benz with a taxi cab. And send boy go home, go ask for God. Ask for what? If me no born for bad. Cause him sell me life like scrap metal. At skull walk round with hot metal. You wet up the place like metal. When the thing them go slap round and clap round and knock round there. Everything get flat round there. Police a stop round there, people a black round there. When the choir them clap round there. Them know them not fi play with this code already. Them know something run like cranberry. Everything them go clap round there, big. Hey, girl, listen, open the door like computer. You call for me, I come
money. It's my father was a gal from the days of Pempal. So forget gal no accidental. And if you see Jordan pretty brown in a road, me now go look me friend dog. We get gal very easy everywhere we go. Get gal easy everywhere we go. We get gal. What we do? Get gal. We get gal very easy everywhere we go. The gal them say they want some my show. We get gal. What we do?
Supremacy Sounds Mix.
Mr. Wacky say cook them. Who not eating at the cook we a shoot them. And nothing nice escape we a cook them. What me say? Cook them, they dance ya hook them. Cook them up. Mr. Wacky say cook them. Who not eating at the cook we a shoot them. And nothing nice escape we a cook them. What me say? Cook them, they dance ya hook them. I want new dancer run the street. Missy boy see a do it, Missy Gabby then I do it. Cook. Disha said nice like something we sweet. Watch out the dance you need. Good. Color. Teach the dancers up to beat. Shakespeare asks the other dancers to beat. Set your hand like you a skip and be a little your feet. All the blind man a do it. Oh, them can't see it. Cook them up. Mr. Wacky say cook them. Who not do it in the cook we a shoot them. And nothing nice escape we a cook them. What me say? Cook them, they dance ya hook them. Cook them up. Mr. Wacky say cook them. Who not do it in the cook we a shoot them. And nothing nice escape we a cook them. What me say? Cook them, they dance ya hook them.
Step to the party like a OG. Party jumping neighbors can't go sleep. Now the neighbors trying to call the police. Fuck the feds. Say you a freak. Show me how freaky. And she got moves like back gallery. Said he hit it right. Go ham when he tap that. You lost 10 seconds. Man, you the Snapchat.
And y'all freaky gal, baby me have to confess me love when you blow that candle day. She had the freak of the week and the freak of the month. She love the party, the weed and the rum. She do a lot of 6 months with the tongue. Very naughty, although she humble. When you wind up your waist like a snake in the jungle. Anytime the first let me come to me sense to the way that get about she took my fence up. And I say she want the icicle in the sun.
Your girlfriend's favorite DJ.
You know the way make me high like a 5 days, like a TP. Customer care, then I set the treat me. Wine for me baby, God for the beat. Sex and the city burn on cannabis. And if I call you a freak, BB, c'est la vie. I this a love, you're not ordinary. Every girl I figure belong, go call to the beat. I'm not this, you're not a distillery. Hello, girl come in my room, lie down. Baby, you want to get my love. All in a one, your name right down. Forever, babe. Baby, you coming like semi-color. Forever, this a love for a lifetime. You never let me lonely. Me love you.
Remember me know who you know right now. Me never trust nothing in your shop. Me never borrow nothing from you yet. Can't say bad mind. Me style them brand new. And me choose them new. Girls stick like you. Watch you. Me style them never roll. Far out me them. And me alone control me zone. Me a woman all about me say. Be near them seat on the road. Right now me a go all out me say. Me say them a fight for the throne. Me a dirty heart fall out me say. I better wanna leave me alone. Tell them I gas me a press me just not stop. Action speak loud, that's how the talk stop. Still a surf on the top and me can't drop. So all of me enemy them a fi fall back. Touchdown a Italy and make a mad stop. And stun from bad mind cause them can't shop. Me no put crosses from me head up on none of them. I know me fitted baseball cap. Me style them never road. Far out me them. And me alone control me zone. Me a woman all about me say. Be near them seat on the board. Right now me a go all out me say. Me say them a fight for the throne. Me a not the yard fall out me say. I better wanna leave me alone.
something me nah say you can't. But me know say you see something you want. When you see how me live out my mansion, big a music and ganja me plant. Now listen, me, you is a nice girl, but without living in a nice world. Me I tell you the truth, me don't trust you. You can't catch me coming no flu. Love not so easy to lie. Love not so easy to lie. Come about say you love me after 1 week, because I'm a house from the hill where I sleep. Love not so easy to lie. Love not so easy to lie. You not even know me to lie. When I your birthday I must be July. I make me see a old bad, make me see a old bad, make me see a old. Make him see a old bad, make him see a old bad, make him see a old. No time me clean up your food, but me did a bad, make me did a go. Me will make you like a new man, make you see a old bad. When that probably more if you broke out like a sword, you will more like you don't drop a floor and roll. Post at a post. Here you what at a cloak, take off like a close. Roast. Watch out the most that a sauce. Me see squad in a deep that a toast. With the money make the oat that a coat. Smarty rock, like a goat. Me go for the I make me see a old bad, make me see a old bad, make me see a old. For the make him see a old bad, make him see a old bad, make him see a old. No time me clean up your food, but me did a bad, me did a go. Me will make you like a new man, make you see a old bad. We no red yard, we no war links. We no baggy, we no love people things. And we prefer what if they can't want links. And no man can text me hello darling. We no red yard, we no war links. We no baggy, we no war boy things. We prefer what if they can't want links. And no man can text me hello morning. It on you this ringing on your ears like a headset. As me never see the cigarette left the blem yet. Me never see the rose and left the end yet. Stay up on the straight, but no for them then yes. Means a boy me prefer to see a friendless. Cause them the link they cut it like appendix. All when you're rich and 110 jet, we still a will it in a week like Wednesday. We no red yard, we no war links. We no baggy, we no love people things. And we prefer what if we can't war links. And no man can text me hello darling. We no red yard, we no war links. We no baggy, we no war boy things. We prefer what if we can't war links. And no man can text me hello.
Supremacy sound. My youth, you too bad mind. You too bad mind. My youth, you too bad mind. My youth, you too bad mind.
I say this the man that walketh not in the council of the ungodly. Island powder no better than me. Them a dash I'll be a dash brandy. Just speak if you hear, must be bambi. Bad mind jealousy a pack a ambi. Oh my youth, something wrong with your dog. You feel looking at yourself hard.
You too bad mind. My youth, you too bad mind. You too bad mind. My youth, you too bad mind. Why make you see yourself? Why make you see yourself? Too bad mind. My youth, you too bad mind. Hey, when you a do you must be crazy. I know me make your work list lazy. I know me make your life fierce up. Your bad mind for you was a little baby. When you see me by the book, don't hear me. You just tell a man say, this is end. Pick up my family, gonna enemy. Gonna be the life of this world.
Bless. If they can't feel better at work, I mean whatever it's worth. I give whatever I'm worth. For my nigga who gon' go to hell and back for me, I'ma give him heaven on earth for a hell of a check, yeah, whichever come first. Blessings on blessings on blessings. Look at my life, man, that's lessons on lessons on lessons. I treat the beat like it's a reverend. I tell the truth like, Father, forgive me, these are all my confessions, man, this wasn't luck, it was destined. I done lost homies who been with me since Ed and Eddie, who flip like confetti, and then when you back, they back to call you dog. That shit can get petty. Don't get no doubt to me. Funny thing about talking behind my back is that it just keep coming back to me. Was off for a sec, now it's back to me. You mad at me? This ain't what I want, man. This what it had to be. This is that late night working after 3, man. This is why my old girl was mad at me. This why I'm your majesty, man. The click is the tightest, the proof the tightest. The drinks are the coldest, the future the brightest. The feet not divided, the love is divided, and I just got it. Thank God that we got it. Bless. I don't know what I would do without a crew. Look like we robbed a bank, but all we make is deposits. Your profit with profit. Oh God.
I'm here for a good time, not a long time, you know. I haven't had a good time in a long time, you know. I'm way up, I feel blessed. Way up, I feel blessed. Straight up, I'm way up, I feel blessed. Way up, I feel blessed. I ain't gon' say that we back or nothing, cause that implies that we're back from something. If we're back from something, it's some checks you owe us. I expect that payment, nothing less or over. I don't need them favors that you asked me for. I could give two about where the Grammys go. I just gave out Grammys on my Instagram. Them OVO boys, the business, man. It is what it is. Trust me, you get what you give. Yeah. You gotta come to my side and see how we live. Yeah. I cannot see heaven being much better than this. Yeah. Blessings on blessings for me and my from the six. Look at what we did. Yeah. Be quiet, I'm doing a toast. For that don't really do, that's where y'all be doing the most. Stop worrying about whoever's next. I am just worried about my mama worrying less. I think I'm famous enough. I don't need any more press. I am convinced I'm the only one left that's still doing it. I'm here for a good time, not a long time. You know, I haven't had a good time in a long time. You know, I'm way up, I feel blessed. Way up, I feel blessed. I'm way up, I feel blessed. Straight up, way.
Simple Simon. I woke up feeling like I was on the moon. I woke up feeling like I need 100 gold. Look at them, look at that wrist. 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 I woke up feeling like I was on the moon. I woke up feeling like I need 100 gold. Some niggas in my sleep trying to catch me. Some niggas in my face trying to free. Catch it, play on these niggas. Touchdown. I'm my own quarterback. Put my teeth on. Luxury. That's all I see. Look at them, look at that wrist. Got them on me. On C. On C. California loud. Got me lit. I'm the shoot. Take up. You better duck. Boom. Or you get hit. Get your leg. Get your leg. I woke up feeling like I was on the moon. I woke up feeling like I need 100 gold. Look at the look at that wrist. 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 Baby, won't you come my way? Got something baby, won't you come my baby, won't you come my way? Got something I want to say. Can I keep you on my bed? But first, I'ma start by saying this. All the shots, they think you can take my view. And that's so tough, and I shoot so hard on this. Baby, won't you come my way? Baby, won't you come my way? Baby, this is something you should know. I don't ever chase no. Spotted you had that glow. Watch me pull out all this dough. Take you where you want to go. Flexing on your ex, I know. He ain't never take you out. Barely even left your house. How dare that run his mouth when his pockets in a drought? The last single he put out didn't even make.
Here is my son. Go and bring him. Do not ask questions. We have very little time. The judgment will suffice. My son is representative for all the men we want to hate and hurt.
representative for all these people. Our stories are so painful to tell, and they're painful to hear. But someone has to pay for what we went through.
We are not even sure of what may become. What if he becomes a rapist like his father?
He should be treated like a crocodile because he is. If we leave him around, he could link up with fellow crocodiles, which will teach him how to be a crocodile. I am bitter. Who isn't? Every man has a crocodile in him. It's inborn. It's in the blood.
Wewe, are all rapists raised by men? Bring Kijana down here.
Let me be the one to plant a knife through his heart. I brought him into this world, and I will take him out. I have lived with the humiliation your father or fathers took me through all life. I suffered 9 months carrying inside me, wondering what you would look like when you came out. Would you be a little monster like your father or fathers were? You came out as you. I have loved you for 18 years, waiting for this day when you would grow into a man and I would exact my revenge on a real man. Today, you will pay for what your father or fathers took me through. Let me stab him.
Not Jane. This boy is your own blood. You shouldn't be the one to do it.
He is not my blood by choice. He is a man. The man I've waited for to take my revenge on.
Yeah, the sooner we take him out of this world, the better. All rapists are born by women.
I will take out mine before he has a chance to touch or hurt any woman. Please, do not deny me this. You can burn me after that, or stone me to death. But after, I have had my revenge on this pain. In that horrible moment, they were 5.
In fact, everyone feels that way when they are sexually abused.
Angry?
Stop sexual violence. I have a pleasure. I have the right to sexual pleasure.
Round of applause there for Theatre Factory. Theatre trained, you can tell. Wonderful there. Thank you, ladies. And the gentleman. I thought there was a gentleman. Oh, gentlemen, my bad. Okay. So are you warmed up enough? Are you good? Some more entertainment? You still need to wake up. Ladies and gentlemen, well, there's a dance group. You and I, it'll be our first time. Why are we excited? I haven't even announced who's coming next. First of all, let's recognize the presence of someone who's very close to the youths, who is a voice for gender equality and all matters sexual health, Dr. Miriam Atembe. Welcome, it's good to have you this afternoon, and she'll be one of the panelists so you can prepare your Q&A. But as you do that, ladies and gentlemen, some more entertainment as we have a dance group called New Phase. Obrigado.
When your legs don't work like they used to before, and I can't sweep you off of your feet, will your mouth still remember the taste of my love? Will your eyes still smile from your cheek? Darling, I will be loving you till we're 70. And baby, my heart could still fall as hard at 23. And I'm thinking about how people fall in love in mysterious ways. Maybe just the funny now. Take me into your loving arms. Kiss me under the light of 1,000 stars. Place your head on my beating heart. I'm thinking out loud. Maybe we found love right where we are. When my hair's all but gone and my memory fades, and the crowds don't remember my name, when my hands don't play the strings the same way, I know you will still love me the same. 'Cause honey, your soul could never grow old, it's evergreen. And baby, your smile's forever in my mind and memory. I'm thinking about how people fall in love in mysterious ways. And maybe it's all part of a plan. Well, I'll just keep on making the same mistakes, hoping that you'll understand. But baby, now take me into your loving arms. Kiss me under the light of 1,000 stars. Place your head on my beating heart. be under the light of 1,000 stars. Oh, darling, place your head on my beating heart. I'm thinking out loud that maybe we found love right where we are. Or maybe we found love right where we are. And we found love right where we are.
Ladies and gentlemen, that's New Phase Dance Group.
Como loco por la vida, con el corazón latiendo porque sabe que tú estás. Ay, vida, que palpita de alegría, que me llega el sentimiento con tus besos vacilas. Ahí tienes el dibujo de la luna, la belleza de una rosa y la tibieza del mar. Ahí eres y lo dulce de las uvas, donde bebo con tus labios de la fuente para amar. Bulería, bulería, dando del alma mía, esa sangre de la tierra en que nací. Bulería, bulería, más te quiero cada día, de ti vivo enamorado desde que te vi.
New Phase Dance Group. Now, if only I can have the same attention from you when we have the dialogue. Deal? That's some excitement and rowdiness. We need it. We need your thoughts and your opinions as my able-bodied people carry out the seats. I need about 5 seats, please. Thank you. Before the lunch break, we were having a session on abortion, contraception. You also had gender-based violence and many more. And I'd like to call the moderator. If you haven't been introduced to him, he's our moderator of the day, helping me out today. It's Anthony Itwara. Anthony, come and review. Opogalo, he's in a suit. It is hot.
Yeah, you know these things.
Yes. So if you can just recap for those who just joined us and those who probably missed in different sessions what the afternoon covered.
Good afternoon, ladies and gentlemen. You see how people fall in love in mysterious ways? They illustrated here. Well, in the morning afternoon session, we had 3 breakaway sessions, and one of them was here, and we were discussing putting in perspective abortion. And my panelists gave us enough information and different angles on how we can look at it. Culture, moral, faith, and the legal and constitutional abortion. But also, give us the practical bit of it, how it happens, why it should be there, and why we should help in providing. And we're looking at the different services as far as contraception is concerned, and the different available contraceptives were also being seen in the tents. The other breakaway session was in the main hall common room, and they were discussing gender-based violence, the challenges, the ignorance of men in knowing rights that sexual rights that expose them to a risk of having or infecting or getting HIV and AIDS. Those were the 3 breakaway sessions, and we will kind of reach out to some of you. I know most of you aren't here. You are in the different breakaway sessions. We'll get your opinions when we start this dialogue here, and I won't take much time. I think I have summarized, but also we had the condom bash. When we finally start, I will ask someone who actually went, everybody was around. I'll ask someone to come and tell us what they learned about that condom bash.
Yes, actually the condom bash was meant to teach about communication, that in sexuality and in sex especially, obviously, you need to communicate, obviously. If you don't, then...
So you communicate when you're using a condom or not?
This is a dialogue, Mpozi. We're supposed to talk about things.
Mm.
Someone, interestingly, I'm not going to mention who they are, said it's a gentleman. They actually had a female condom in their pocket.
Okay.
So the... Chichi.
Female condom?
Yes.
In the gentleman's pocket?
Yes.
Okay.
It's a dialogue, but feel free.
Okay.
So he pulls it out and says, but how do these things work? I don't know if he was looking for a demonstration as such.
Or to try it out.
Yes, but there are instructions at the back of the female condom. But him as a guy, he was saying, so my girlfriend or my wife or my partner says, I would like for us to try a female condom because you're uncomfortable with the male condom, or your reasons, allergies,
No. I think a condom is a condom. If I'm uncomfortable with mine, then I'm also
going to be
comfortable with yours.
See, such mentality is what we need to wash out today. Ladies and gentlemen, we have a panel of discussers who will be talking about sexuality or sexual health. You've been told that this entire dialogue is about sexual health for a just and empowered society. If you missed this morning, they asked you what sexual health is. Anthony, I don't know if I remember all the answers. Some said it's being free with yourself and your partner. Others were kind of describing it here and there. So does anyone know what sexual health is? You all don't know. It's a good thing then we're going to have this panel of discussers. So Anthony, if you will come and help me call out our discussers. First, I'd like to welcome the Guild President, Shamim Nkobazambogo. This is Guild President for Islamic University, Uganda. Shamim Nkobazambogo, if you're here. Yes, a round of applause.
Okay, Karen Holmes.
Yes. Karen Holmes.
College of, what is that word?
Worcester in
Worcester
the
in the United States.
Oruzongo. This is Karen Holmes, who's from the College of Worcester in the United States. You know about sexual health? For example, are you never mind. Please help welcome Dr. Miriam Matembe, who's a consultant in women, gender equality and empowerment, and a co-founder for the Center for Women in Governance. Yes.
Okay. Please welcome Muhawenimana Sarafina.
Yes.
TV star, Deception Series, Makerere University MDD student.
You might have seen her already on stage. So please, yes, Serafina Muhawenimana, a TV star and MDD student. Yeah. Sit right next to Dr. Miriam Matembe. I'm sure there'll be conversations. So anyway, From the Africa Albino Association of Uganda, please help me welcome Namaweje Doreen. That's Namaweje Doreen as she makes her way to the stage. Do I have Ahmed Haji? This is the Africa Youth Development Link and Uganda Muslim Youth Development Forum representative, and that is Ahmed Haji.
Wow.
Yes, Anthony?
Honorable Twatwa is requested to join the panel, please.
Please, by all means. Round of applause there for Honorable. Is my panel full? It is? Okay, so first of all, round of applause for our panel of discussants today. Before we get to the discussion, I've been told there's a small interview. I think if your screen is near you, just eyes to the screen then, before we get into it.
Personal relationship. For me, I'm very, very strong on the issues of sex.
Yes.
Because I know that sex is a holy act.
Yes.
Sex was ordained by God.
Yes.
And what makes it holy is that it is one way through which God gave his responsibility to create a human being to us being. So when you approach it, I approach it with that kind of perspective. And for me, to open up my thighs to anybody, my friend, it is
a disaster.
It is a disaster. and that's why I say...
Not disaster, it's real business now.
That's why it must be thought out very, very carefully. And very, very... So let me stop there that now. So when I imagine you in this intimate, private, wonderful relationship, and you are just going out there opening yourself to every woman there.
But the question is why? Why would a man actually...
You were here telling us last time that for men, for them they are made in such a way that this one woman may not be enough. You let me finish on that one and let other people talk. So infidelity is one thing that will get a woman disgusted in the sex of her husband. Secondly, the other reason which causes a problem is overworkload. Now, when you are still young, no babies coming in, no what, you are there enjoying yourselves. Now, when babies begin to come, and the woman becomes overworked, and the man is not helping in this work, then the woman gives the attention to the children, to the other work, so that she is overworked. Let me tell you, sex is supposed to be enjoyed when you are relaxed and able to release your emotions and your whatever, so that it becomes nice. Now let me tell you one thing I would hate. When I retire to my bed after all this work, I retire to go and relax. If I find somebody there waiting to make me indulge in yet another job, and that happens.
Another job.
Let me explain that. You have made it a job. Let me tell you that now third reason, approach. The approach of men have made women detest sex. Let me tell you, I come like I was telling you, I am tired, I'm coming, maybe I want relaxation, then you are there ready to dive and knock off to sleep. I mean, I view it as yet another job to do. The other day I mentioned it a little bit, just because for you, your physical erection is reflected and seen. You never know that also women erect, and therefore you should bear that in mind. You just come in and dive and go. Let me tell you, you are supposed, the woman's sexual organ is a very wonderful, complex organ.
No, I agree.
Which must be, which you are supposed, discover,
compliment,
cherish, caress,
two-way thing.
Exactly. We are now talking.
All right.
Uh-huh.
I'm assuming some of you already have questions. Discover why. But no. We are tell us their understanding of sexual health before they give us their views and reasons of how we can actually use sexual health to achieve a just and empowered state. Now, Anthony will be up there, so he'll be in charge of the panel. Now, down here, if you have a question when we start our Q&A, you raise your hand up, I'll reach to you, your name, and if you study here or Wakowa, you also tell us, and then of course your question clearly. So, Anthony, to you.
Thank you, Flavia. My name is Anthony Itwara. I like talking about sex like Honorable. I also like it, and I think I have discovered, but you are not supposed to discover this time. Yes. No. There are people who have the right to discover. Okay, ladies and gentlemen, we're going to be discussing, we're addressing sexual health for a just and empowered society. And in that, we want to look at the role of families, schools, the media, and social community in addressing these issues of sexuality. And of course, that is sexuality empowerment for positive sexuality and sexual health empowerment and uptake of health services. It's quite a mouthful, but I will try as much as possible to go slow and we understand it. And I will start with the Sarafina. Yes, the question is, when we talk about sexual health, what do you understand as you, Sarafina?
As me, as Sarafina, Mhawenimana. Sexual health, I understand in this form. I understand that beyond my organ, my brain, my emotional, my psychological, I should be up straight with anything concerning it. Is it healthy? Is it functioning? How does it function? When does it function? For what? When? Where?
Wow. So, okay. Pass the mic to Namawe J.
Correction to Naweje Doreen. Yes.
We're talking about sexual health here. When we talk about sexual health, what do you understand, you as a person?
The definition may comprise a variety. It's quite comprehensive, but I'll summarize it the way I perceive it. All elements, I would say, or components that make up sex, and then health, sexual health. I'll consider the environment that involves sex, that involves the act of sex, where sex is had, being that we are also sexual beings, males and females, everything that makes us up to be in good condition, mentally, psychologically, physically, and any other organs that make the environment favorable for sex. That's how I understand it.
Please pass the mic to Karen. Karen, when we talk about sexual health, are we talking about sex and the environment of having sex? It's a question.
It's a big and wide range of things that you're talking about when you're talking about sexual health. As you were saying before, you're talking about your mental state, your physical state, your emotional state.
Flavia will simplify, don't worry.
I'm sorry if my accent is
yes,
funny.
It's okay.
But when I think of sexual health, I think of something that's defined by you. And you're defining your own sexual health, making your own choices, deciding what's right and wrong for you, whether it's contraceptives, whether it's reproductive health. So sexual health encompasses all of that.
Madam Shamim Kobusinje, is there any difference between the sex health, sexual health, or sexuality? Any difference in those words?
There is a difference.
Yes.
To me, sexuality is the capacity of humans to have erotic experiences, responses. And like she says, that's how I define sexual health. So there is kind of a difference between sexuality and sexual health.
Okay. Let me have the mic. That was to understand when we talk about sexual health, what we are talking about, and the panel, what they understand about it. But we are discussing the role of families, the role of media, social communities in influencing, having the right perception, putting it in context, and also empowering people and the uptake of health, sexual health services. Now, I'll go to Miriam. The question is, what is the role of family in helping young people understand their sexual health?
Of course.
Okay.
So, responsible manner. You bring up that child, nurture the child, train the child, responsible citizen in all ways, including the matters of sex.
So you agree that talking about sexual health is talking about having sex, the act of having sex?
No, don't reduce me to that kind of thing. Why did you organize this conference? You understand the theme is about
sexual health, sexuality.
Sexuality and how they need sexual health to be responsible. Why we are here.
Okay.
But when I see these issues, I imagine that you brought these people because you are concerned handling their sexuality. Don't you know that a human being is a sexual human being? To talk about their lives, and central to their lives, which actually disturbs us as parents, is the issue of sexuality. We as parents, we are concerned about that issue. And I thought that's why you are bringing them here. Because central to our lives here is that issue of sexuality. And so, every parent is expected or obliged to educate their children as they grow up from childhood to adolescence to maturity to the other time when they are entitled to play sex. To tell them about those issues as they advance to the right time to get involved in them.
Exactly. That's the role of families to do that. But are families actually doing it? Honorable, do you think families are actually doing their right role as far as sexuality of young people is concerned?
you, moderator. Of course, the subject sexuality, as you is a very interesting subject. When you start talking about it, the books, if you read about the forbidden fruits, the sexuality of the younger people is concerned, I would say yes, but also no, to some extent. Some families, yes, they are playing their role, like Honorable Matembe has just been saying. Families are supposed to educate, train their children right from really the time a child is born, after the child graduates into an adult. Some families are doing that, but I would say that here in Africa and Uganda in particular, many families, they have shunned their role of training, educating their children. Some parents, a good many parents or families, they have left this role to, they think that the schools or the media will do it for them. But I think this is wrong. Parents should take the responsibility of really talking to their children, training them so that they can grow responsibly, respect their sexuality, respect their bodies until such a time when they are mature to engage in adulthood sexuality.
Okay, your statement is quite very clear. Please pass the mic to her. Your statement is quite very clear that parents are supposed to teach young people about their sexuality until they grow up, until those issues of having sex. But you kind of parents stop there until they don't actually go to that part. Young girls have grown up knowing that they have to dress up like young girls. They are girls. They have taught them how to live as girls and boys. But when it comes to the issue of having sex, that one is left out. I want to confirm with you, Shamim, as parents, at what level have they stopped talking about sexuality with you?
The level that I've stopped? Before marriage. In most cases, a parent will talk to a child in the process of preparing for marriage about sex. Yeah, that's the time most parents tend to talk to their children about sex. In Africa.
Let's talk about in Uganda, at your university, where you come from. Do you think even at that level, students are not having sex until they are getting married?
Of course, no. Like 90% of the students, of course, are having sex, but most of them are having sex with ignorance. They are not being advised by the parents. They just go into sex, that's all. And they don't have the knowledge of the family planning methods.
That's enough within the first year when we studied introduction to biology and that kind of thing, I found out how people get pregnant. So when I came to learn as to how they get pregnant voluntarily, I said, for me, no way. I'll never get pregnant. And I tell you, that swamp kept me, because whenever I would go to visit in Tare and the boys are talking their points, they would go over my head because my mind would be at the swamp. And the swamp protected me. But you can imagine, these days, which girl can you terrorize like that and she believes you? So the fact that now things have changed, the environment has changed, circumstances have changed, the methods of approach and upbringing children must change. And I've been telling parents very seriously that they should sit there. You know, when you tell them, they can't believe that their girl, even of 17, is having sex. They can't believe it. They just want to believe in the innocence of these people, and they the fear of knowing that their children are involving in such activity just prevents them from introducing the subject to the children. And this is very dangerous. So these people end up learning through peer pressure, this pornography, and these things we are playing here which are dangerous. You know, this kind of, what is it called? Music.
Dance.
This dance I saw here is really very bad, because I'm sure it's very bad for people like this. I'm sure some of them out there were busy erecting because of watching these things. And what do you think they will do when they go home? So these are the things now which are teaching them, and in the end, they have become vulnerable and lost to that kind of behavior because of the fault of the parents not telling them the truth.
Thank you, thank you. On our parents, we're going to add on someone. Ahmed Haji, African Youth Involvement Link and Uganda Muslim Youth Involvement Forum. Please welcome Stefano. You found us discussing about sexuality and how we are communicating to the young people about sex. Parents, families seem to be doing a good job in as far as making young people know what they are, what girls do, how boys behave, but they forget to tell them how and when and why they should have sex. Ahmed, do you think religious communities have done enough to educate the young people about sexual health?
Thank you very much, task leader, and really I apologize for really showing up late, and usually when you come in late you just have to collect your thoughts and your minds together, but I'm very pleased to be here. Just straight to your point, I think in my view sexual related issues are human related issues. And one of the things that we need to really put into this context, usually when it comes to issues of religion versus sexualization as a discourse, people tend to relegate the responsibilities to the parents. Because in the first place, people feel that, like within the religious circles, that the responsibilities to do with the right information that I might require as a young person to make those choices, which are choices any human being makes, because these are reality or transitional realities that we all go through. It's a responsibility of, it's a whole society responsibility, and it all starts from the basic, which is the family. We've got to have these frank discussions, for example, how my body sort of transforms and what sort of implications do I have to realize later on. It's really unfortunate that what makes the religious sort of fabric is the family, and many of these conversations are really not happening there. When they choose to happen, they choose to only happen by sanctioning and sort of condemning young people for sort of going it too rush. But I think it's one of the things that we need to start having, and it's a whole society conversation. In my view, I feel that the religious I would speak for the Muslim community, and I would say that if you read the Quran, it's a daily conversation, because the Quran has a full chapter that really sort of defines, the morphology or the changes that you go through. But it's unfortunate that some of these interesting texts that really specify how we need to communicate to the young people to make the right choices are not, passed over to the young people, because you fear that when you start having this conversation, it's more like you're inviting them to sort of indulge in this wild.
Well, it seems that we're talking of what is supposed to be done.
Yep.
But it's not done.
Yeah, it isn't done because...
and the most unfortunate bit is, I can bet that 100% of the panel people on the panel have not learned their sexual health from family. So let me start with you. Where did you learn your sexuality from?
That's a tough question for me. From the peers. Because my background is different, because I started learning about sexual responsibility through peer education. And I think that started as early as in the early 90s, that's about 95, 96, 97, where we had the whole influence of peership in terms of education support, or that sort of social capital support in form of education. And I was fortunate that these kind of programs were really extended to us. But where, you know, I was privileged because I went to a school in the city. But how many of those are like me and they have to sort of learn to experiment and make a mistake? And that's why we need to emphasize the aspect of structural empowerment in terms of information, and importantly, providing linkage and the services to the young people. And I think it's a society responsibility. I learned because I was privileged because these opportunities were there. But let's imagine a scenario where many would not have these kind of opportunities, where you have social capital support education or the peership of education that was done by the days of Family Planning Association of Uganda before they transited into RHU. Not many get such opportunities, but I think it's very important because it's part of intellectual preparation, but also importantly, it's part of human capital development preparation for a young person. Because as a nation, we want to have a healthy, well-prepared, and a productive nation for this country.
Okay, are you finalized with this question? Why do you think parents are not talking about sex with their children?
I think they're naive.
Naive?
Yeah.
Pass the mic. Pass the mic to Karen. Karen is here. Karen, where did you learn sexuality, or your sexuality, or sexual health from?
I think all sorts of things. Like we were talking about, I think peer education is one of the first forms of sexual health that students start to get, whether or not that's accurate. A lot of things we get are rumors. A lot of things we pick up at school from our peers are myths. And I think that that's why it is the responsibility of institutions and universities and primary schools and secondary schools to take on that role of educating the youth and educating their entire community. One issue with relying completely on family education is that we have parents who didn't have that education. So what ends up happening is just a cycle of myths being passed back into the next generation, when institutions and other bodies of knowledge could be implemented so that we correct those myths and those rumors.
So they can't give what they don't have. Shamim,
Yes.
where did you learn your sexuality from?
Actually, when I was in my primary 6, we had a club. It was called No Sex Club, but that club was the aim target was that promoting virginity amongst the pupils. Yeah, so that's when I started, learning about sex. Of course, they couldn't tell us what sex is, so you could imagine what they, of course. Then I started, of course, in watching movies. Yeah, I could watch movies, and of course, you see those romantic movies, people having sex, you start imagining. Yeah, that's how I started learning about
And you look out for someone to practice. Now, Honorable, parents, most times, they feel when they give information to young people, they will go and practice. Do you think, you being a parent, do you have the same fear? Most parents feel that if they talk about sex with the young people, they will go out there and practice it. And do you think that's what happens? You being a parent, you have the same fear of not telling young people about sex?
Okay, thank you very much. But I don't think the parents fear to give sex education or to talk about sex with their children, thinking that they will practice it. Actually, it is on the contrary. They think that when we talk to younger people, like we are doing now, the issues of the subject of sexuality, they think that the children, we are now training them to go and do what? Practice sexuality. I think the parents do not want to talk to the children. I think it's just a question of being shy. It is not that, yeah, they are just shy. It is not that they don't want to pass the information.
So do you pass on information to your children?
Yes.
About sex, when to have sex, why to have sex, how to have it. That last one.
I would say not completely so.
Okay.
Although I'm a medical doctor,
Yeah.
I only talk now to my adult children, but when they are young, I was feeling a bit shy.
Okay, Flavia, are you there? Where is Flavia?
Right here.
Find me a lady and ask them a question for
What
me.
question would that be?
I want to know who in this congregation has learned about sex by their parents.
I was actually asking the exact same question, but those were gentlemen.
There is one there.
You learned from your parents? You want to know what they told her? Or?
Yes, I want to. I want to first know whether they told.
If you want the details, that's okay.
Yes.
Your names, please, and answer.
I'm Winfrey.
as the children grow up to instill ethical values and morality in them. The values that I have, the integrity that I have, was instilled in me by my parents, by the ethical values they set for me to follow. And therefore, laws cannot help us at all, I'm telling you.
The other
you cannot go for those laws, they will not work.
The other question was about harsh parents who do not give information, but they are harsh to their children and they end up doing mistakes.
They do what?
End up doing mistakes, young people.
Yes, I know. Now that I know, because now I'm so much exposed, I know so much, and I relate to young people, we have exchanged. Now I really know, and I go to a big extent in counseling to relate to their children. But you know, somebody talked of generations. You see, as I told you, the way you cannot impart to your children what you do not know. So that's why I was saying that it is now necessary with this modernization and globalization that parents should really be trained into parenting. They should up the children, and now that values are no more, because I can assure you cannot now tell these young girls here that abstain from sex, virginity is good. All these men and boys will say, backwardness. Now that things have changed, then parents need to be educated on how to meet the circumstances and bring up their children accordingly. Because I'm telling you, we as parents, we wouldn't want our children to go to marijuana. We don't want them to go to homosexuality, gayism. We want grandchildren. So we don't want you to go and get pregnant outside marriage. For us, we don't want all those things. So when we are telling you in love. And then for you, you say, we are harsh. And when we are harsh and you go and offend us, then we chase you away because you have hurt us. So both of us, let me tell you, it takes two to tango. Now that you are big people, you at the university, you should be able now to know that you are responsible people, and if your parents have been harsh, you can see how you turn around to discuss with them and tone them down instead of saying that since they are harsh, I'm running away, and you are doing it by way of punishing them, some of you. Me, I'm appealing to you now. You have an opportunity to listen to me, at least. Go and feel sorry for them and know that whatever they are doing it in love for you. There is no single parent who is doing anything to offend you. They are doing it in love for you, but maybe they don't know how to do it the right way. And as I conclude, because I cannot leave this podium without talking about this issue. She was very good. She said that the generation, we and her generation, we do not understand each other. And indeed, we cannot understand each other unless we know a person who is a person of generations. When we know that, then through that, we can understand each other. And don't call me backward, but I want to tell you that in the Bible, it tells us, God of Abraham, God of Isaac, God of Jacob. That means God is a God of generations. And if you want to understand a generation to a generation, you need to have God in you to be guided to understand generations. And for me, as I live, I want to appeal to you. You need to get to know God as because even where your parents failed you, your God cannot fail you. Because your God created you, your God has plans for you, your God knows you. If you find we as parents are failing you, go into a closet, seek your God who gave your father and mother responsibility to create you, to deal with you, and things will be fine.
Okay.
Thank you.
Ahmed Haji, this question, someone says, who do we blame for the current immorality among young people? Who do we blame for the immorality among young people?
I don't want it to seem that, because listening to the Honorable, there is this tendency of thinking that there is a clash of generations here, which I don't think there is a clash of generation, of any generations here. But the thing is, one thing that I really want to bring to the fore is it's not a moral question, but it's a human question. And I think one of the things that keeps coming up here is, truth be told, that generation has its own innovations, its own comprehension, understanding. I mean, this is, and I agree with James, the question of appropriate, like sort of communication, to me that's critical. My colleague talked about, that the entire society, and I began by saying that it's not an issue of only parents. What is moral to you might, because the morality is contextual. What is moral to you might not be moral to me. And I think that's where some of our parents, I'm a parent as well, but that's why we get it wrong. Because what you define as moral, to me, it's a lifestyle. And I think one thing that we need to appreciate is communicating with, not communicating for, or communicating at. We need to understand that young people today are experts within their own opinions, within their own experiences. I mean, they see a lot and they learn a lot online because they are digital citizens. And that brings me to the point of saying that it's not about the parents alone to sort of provide the information.
Haji, the question is, this generation is not talking about abstinence, it's talking about having safe sex. Whereas the other generation was talking about abstinence. So who is to blame for such kind of generation?
I don't think we should blame anyone.
Let's take it differently. Who is to take responsibility for how they are behaving?
It's a whole society affair.
Okay.
Parents have a responsibility, teachers have a responsibility.
Okay. Any other question?
Everyone has a
responsibility. Yes, somebody said the biggest percentage of young people is sexually active, yes. So how do we make it healthy?
Appropriateness of timely information, and create facilities for them.
So are you saying it is right for them to be sexually active at that age?
Why not? Why not?
Pass the mic here. Pass the mic.
Why not?
I want to ask him a question. So, why do you dare blame parents for anything that happens to you? Because if you are saying that you have grown up, you have different opinions, you know what you want, then you can take it and go and play sex. For me, when I'm saying abstain, now, if you go and play your sex and get your AIDS and get whatever you get, who should you blame? Why do you blame me for failing to guide you?
No one is blaming parents here, but we're reminding parents that they have a responsibility. But the point here is, I just want to come to the point.
You see,
with or without the parents,
Ahmed,
they will still access information.
Ahmed, this is the question. A young lady said there that 90%.
90%. She said 90%.
90% are sexually active.
Yep.
That how should we give them, how should we help them have it safe and what?
Healthy sex.
And healthy. And me, I'm asking, because when you start trying to make it safe and healthy, that means you've already okayed that it's okay for them to have sex.
But without giving them that right information, they will still have it and still have the same problem. So I think you don't run away as a parent because you need to guide them. And I'm not saying only the parent, everyone has to guide each other. They're already accessing information, by the way, or either way.
Let me have the mic to Shamim.
Shamim, yes.
Shamim.
We need to give them effective communication. I think that's important.
Shamim.
Okay.
Shamim.
There was the last question. Shamim, I don't know if this is the generation you grew up in, but Sauma asked, what is your say or take about kids' games that are related to sexuality, like mommy and daddy?
Thank you very much. I will relate it to your question that whom should we blame? Actually, the blame is on both the parent and the child. Sometimes the parents tend to counsel and guide the children. I have a friend, she used to narrate to me that whenever the parent could call her and start telling her about sex, She could be like, Mommy, why are you telling me that? I don't want to hear that, please, you know? So sometimes the children are also not free with the parents. So the blame goes to both. And the parents who are not free to their children, my appeal is let the both sides be free to each other. Then things will be easy. Then on the other point of the mommy
and daddy games.
Mommy and daddy games.
Yes.
That's mostly to parents who live. You find parents living in a single room, and they are living in a single room with young children, and when it reaches night.
I think that is the wrong context. The context of the question is the interpretation of these games as far as sexuality is concerned.
Yes.
When a young girl plays mommy and a young boy plays daddy.
Apparently, the games to give information about sexuality teach young people or young children about sexuality.
It's about responsibilities and how daddy behaves and how mommy behaves. It's not about sex.
All right.
Give to Connie. Connie wants to elaborate on that.
Oh, to elaborate on that? Okay.
Okay. Now, some of you, this generation, you think there is a generation gap. We did have the games Mama and Tata. Am I right? We did have them. You did have them. They did have them. It stopped at that. But we are passing on the blame. I personally am a youth counselor in the Career Development Office. The problem is many of you here just don't want to listen. You feel it is of another age.
Maybe it is how you package the information.
No, Anthony. I'm talking through experience. Yes. I've worked with high institutions of learning and I've been a lecturer. And what I'm doing right now, I'm in the Career Development Office. I'm looking at challenges that are affecting these people out here. Now, sometimes you students do not understand where you come from. You just don't understand. They get to university. You even change the walking, forgetting the humble background where you come from. It takes me back. Remember where you come from. It is very easy to go with a bandwagon. We are all campusers, but drive back home where you come from. How is it there? We are looking up to you to save your generation. Number two, many a time you forget you are at university. Friends, if you are in school, let school be school. If only I had time, oh my God. School means what? School. But many a time you want to be in school. 1 foot. Saturday you try it out, scrubbing saucepans in somebody's place. Monday you come back. You'll compromise on one.
Okay.
Lastly, where are you going? You need to get to know where you're going. This whole sexuality thing, you as a person, where are you going?
Thank you very much, Connie.
Anthony, before we go, I noticed something. There was a quick discussion here, and someone said to me, but we do have Karen Holmes on the panel, and it would help to understand that we're blaming our African society about how they handle sexual education and sexual health. But perhaps Karen can give us a perspective from where she comes from, and how they first of all teach young people about sexual health. Is it any different than what you heard parents talk about and the young people, and what you probably can tell us to help our plight?
Well, it's been really interesting to hear this discussion because I do think there's kind of a disconnect in what two generations are talking about in terms of sex education. I think that the older generation is talking about abstinence education, and they want to promote that to their children, and the younger generation is saying the reality is 90% of students are having sex. 90% are engaging in sex, whether we want that to be the case or not. So the younger generation sounds like they want to hear about a different kind of sex education that can help them prevent STDs, that can help them prevent pregnancy, that can help them to have a healthy sex life so that we can be sex positive and positive about how we talk about sex instead of shying away from these issues. And in the US, we do have sex education in our schools. Some still have abstinence-only education, and others have holistic, safe sex. And what we've learned through tons and tons of studies in the US is safe sex educational system have less teen pregnancy, have fewer rates of STDs, and have better sexual practices within their youth. So.
Okay, thank you, Karen. I will give a last to Honorable Twata. Now, you've heard about safe sex, healthy sex, and abstinence. Do you think this young generation being sexual active is okay? And if it is not, what do you think should be done to cap that?
Thank you very much, moderator. Of course, I've been listening attentively. Of course, being sexually active is not a crime. It is a normal process that as a person grows up, he or she will increasingly get sexually active unless if there is something abnormal. What is important, what I want the younger people to know is you grow up and you increasingly become sexually active. How do you manage yourself? How do you manage the process of growing up? That is very important. From my own experience, of course, I was like you many years ago. And up to now, of course, I've been going through the process. But subject matter, when we talk about the sexuality and you're also talking about sexual health, how do you engage yourself in sex and at the same time you remain healthy? There are various consequences which I think you know. You have been mentioning some: abortion, STDs, HIV, dropout from school, and many others, those consequences. So for you, particularly the younger men, I want to say that, one, as you grow up and you intend to engage yourself to get sexual active and eventually, of course, you get a home, you should, at any one time, make sure you have one queen. Don't have many queens, because these days I'm hearing stories where you get a gang of younger boys, they are actually on one girl, etc., etc., those stories. Or somebody has multiple partners.
Thank you.
So, I'm concluding. So, I would like you to ensure that that principle of abstaining, that principle of remaining faithful to one queen is very important, other than you engaging in multiple partners. The same thing with the girls or the younger ladies. If you don't observe that, definitely sooner or later you get into problems. I grew up at the time HIV struck at this country. I was still a young man. And I can assure you, if I didn't discipline myself, I don't think I would be here before you. So that is the word of caution. We are not saying that, I know the generation has changed, but you have got to have discipline within yourself if you have got to live. That is what we talk about, safe sexual health, if you have been listening.
Thank you very much. Well, I don't have that much time. Our time is up. Now, first of all, I know that young people are sexually active. then I know that I'm informed. So there is no one to say that I don't know. I have not heard. There are peer groups like where Serafina went, you're being active. So it is also very important that as you are active, you know or you seek information to have safe and sex for a healthy sexuality life. Me, I'm saying, I have not concluded. The other alternative is you should also abstain. Let me give you this last bit and you say it.
No, you know what I want to say, and in fact, since we are concluding, I will stand up. Activity and active. And I'm glad that you put my video there. And let me tell you, there are timeless principles to another. This whole idea of you wanting to think that things have changed and therefore you do things the way things are changing, I don't agree with. I'm not saying that you are going to stop your sex and all that kind of thing. Principle that yes, let me go and be active as long as I'm using condoms, I'm going to treatment and that kind of thing. Because for me, in fact, this issue of sexual activity disturbs my mind. Does it mean that anyway you meet this boy, you sleep tomorrow, the other day you meet another one? What exactly does it mean? Because for me, like you had in my video there, I look at a human being as a dignified body. You must look at yourself as a dignified body, a body made in God's image, and therefore expected to be treated that way, and not just to abuse it right and left. And therefore, for me, the message I leave in this, let's decide to respect our bodies as the temples of God and live dignifiably, but knowing that the devil is rolling around and can tempt us at one time, and therefore, because of that, we protect ourselves in case, and we make sure we are healthy. But not just a blanket that you go and be active because you can go to clinic, because you can practice safe sex and that kind of thing. So for me, my but I want beautiful grown-up university graduates who can become responsible citizens in this country. Thank you very much.
There is no better way to conclude it. My name is Anthony Itwara. Thank you. Hey, Flavia, you are on.
Hey, I was waiting for a proper conclusion. All right. So, do you, as Anthony, know about sexual health? Because you looked more confused than some of us.
Sexually informed, and I practice good sexual health, and I enjoy it. And by the way, I started it at the right time. You should also consult me when to start.
Okay, thank you so much to our panelists. Thank you so much. I think we'll conclude this part. Perhaps you can lead the ladies and then the gentlemen will figure it out. Thank you. Anthony's days. Round of applause there for our panelists. We did have Shamim Nkobazambogo, President for IUDUg15, Muheyimana Sarafina, Karen Holmes from the United States, Honorable Dr. Maria Matembe, Nawedje Doreen, and Ahmed Haji. As we round up today, ladies and gentlemen, allow me to call on the Gender and Youth Coordinator for Reproductive Health Uganda, James Tumusime, to take us through a roundup of what we had today and whether we have actually achieved our purpose of this dialogue.
Thank you very much. My namesake Flavia. You know, choosing Flavia and Anthony for being the faces of today is not an accident. It is very deliberate. For those of you that are aware of these social media and other .com things that we are using as excuses, I encourage you to go to YouTube and download The Life of Flavia Tumusime. It is there. You also can find a brief, not so much like Flavia. I don't know whether it is me who knows it, but also something about Anthony Twara. Flavia is a very young person, but she has a rich life to share, one that can be very encouraging for the other young people that are here, to kind of pick an inspiration from what other young people can do. Then Anthony is not very old either, but he has been places and he has grown in the media world, and there is a lot to learn from him if you follow his profile a bit. Ladies and gentlemen, allow me to pass my thanks to the very important people that put this event together. I want Alex Chwanuka to come up here. Alex has been up and about. Alex Chwanuka and your team, please come up. But above all, I also want to thank Makerere University, especially the College of Humanities. Professor Shirumira is not able to be with us. I don't know if there are other people that are left from the college. I want to thank our very seasoned panelists. I'm very grateful to the Honorable Dr. Miriam Atembe, who had to travel a very long distance this morning, and before reaching her home, her first destination was actually this place. So we are very grateful, Honorable, for that endeavor to be with us. I want to thank the participating universities. There are about 7 universities here. There is Makerere University, there is Chambogo University, there is Islamic University in Uganda, there is St. Lawrence University, there is 2 other universities whose names are not on my head, but I'm very grateful that they're here. And I want to thank the other participants that are not necessarily from the universities but have been here with us. We had our partners from CHUSS. We have other partners from other NGOs that have participated in this event. We are most grateful. I'm very proud to put this team before you. I think the oldest person on this team is not 30 years. Some of these young people are in school. They're in the university themselves. I don't know if this is exhaustive, but these are the people that have put this dialogue together. And allow me to ask Alex, not necessarily to introduce one-on-one, but to say a thank you to the team that you've worked with, and also to share anything that you feel you should want to share. Because I think a lot of Alex's work and this team is in what we have seen today. So I want to appreciate Alex. Alex, please.
Thank you very much for honoring our invitation to make it a point that we pull heads together to discuss a very pertinent, very controversial issue in our lives, in my life, in your life, in our life. But putting all that aside, I believe I love to appreciate my team members for putting in all their effort to make it a point that, irrespective of the different levels we are, at least they add an impact at various levels in the different processes that have been taking place for the past 1.5 months. I know it's not been easy to make it to this day, but Here and there we try to endure every other circumstance that comes up. But I believe on a scale of 100, my team members will attest. We gave this dialogue a test last year, and for those who attended it, you've been positioned to realize that there is some improvement in the different aspects. At this juncture, I would love to give an opportunity to my team members just to introduce themselves, and then we go.
I'm called Busama Shafiq.
I'm Joan Navaga. I'm Nabasa Rebecca. I'm Annette Anteye. I'm Babi de Rachel. I'm Babi de Diana.
James Nsuga is my name. Douglas Kasiri.
Nakazibwe Donna.
Kijero Samuel Amos.
Namukuza Daphne Olga.
Jackson.
Kainza Grace. Masinda Gile. Babi de Esther.
So members, thank you very much for whatever you put into this event. And believe me, more is still what? Coming. I'm urging all people who are here next year beside the dialogue, we are unpacking as reproductive health, another national event, which is going to be having a lot of inputs of different young people as the people who are here. Thank you very much.
Thank you very much, Alex, and the team. About Reproductive Health Uganda. Reproductive Health Uganda is a voluntary national level organization. We have our offices in Kamocha, Plot 2, Category Road. There is an old office called USO, Uganda Women's Efforts to Save Orphans. We are their neighbors. We're also neighbors to Save the Children and Dax Carrier. We are close to a place they used to call Mariandina Clinic. So if you want to find us, that is where we are physically located. Our work revolves a lot about young people and is reflected in our mission. We have been sharing our documents out there. There is a lot to learn about us. We have space for young people. We have an open internship in the months of June, July, August, up to September every year. And we take in several young people that come to work with us in that time. And we give our knowledge unsparingly. We spend time with them. We take them to the communities to look at the things that we are talking about, the issues of sexual and reproductive health, the issues of family planning, the issues of spacing children, the issue of not having children you're not ready, the issues of social protection that we deal with, among others. So you're welcome, those of you who are in the university and you're looking for an internship, come next year. About this event is one that I have mentioned earlier that we've thought about as a way of trying to demystify, above all, issues of sexuality. As we have been trying this morning up to now, we have spoken a lot about sexuality, but we have not exhausted even a little bit of it. So there is a lot more to learn about sexuality. Sexuality is being human and being complete. It is being cultural and being societal, like the panelists have presented. You do not have to deviate from what your society says for you to be a young person who is sexual in this age, so-called .com. You can still be .com, be sexual, and still fit within the values of our society. That sexuality is personal and private, that everyone has a chance to express their own self in a manner that they are comfortable with, but like I've mentioned, remain societal and cultural. So we are targeting to empower young people and adults and other gatekeepers. So it's not just about the young people, it's about giving opportunity to the people that are continuously involved in passing knowledge, in interacting with young people, new experiences, new knowledge on how to deal with young people. I'm sure that the people who are on this panel have learnt a lot. Also the people who are seated out there have learnt a lot. We shall broadcast our session after we've tried to summarize it on TV, and we hope that we shall still reach to many other people, especially parents, to kind of give them a new dimension of what it is that young people are thinking about. I have personally been doing this work for some time, and about a month ago I was in Jinja. And when I was in Jinja, we were in one of the sub-counties and went to a small class in secondary school. And I told them I'm coming and I'm talking about abstinence today. I was in senior one. One of them voluntarily said, "Sir, we want to hear something else, not about abstinence." I tried to take the consensus, and everyone in the class actually said, "Yeah, sir, we know you know many things, but we don't want to talk about abstinence." I was with some colleagues from the Netherlands, so they were there. They said, "Oh my God, we thought this works." We went to senior 4, which is a higher class. So I said, we shall talk about career planning, abstinence, ABCD. I said, what do we talk about first? Then they said, tell us about family planning methods. I said, but are you planning families? They said, yes. I said, are you serious? So let me begin with abstinence. Then one of them said, you know, I heard about abstinence for a long time and it didn't help me. What has actually helped me is because finally I got to know how to use contraceptive pills. That was about a girl of around 16, 17. Then I said, no, that is a unique case, others want to know. Then a boy said, actually, sir, me, I am married. But when I am here, I am also a student. And all these people know that I am married. So abstinence is not what I want to hear. Just to say this, to say that some of us out there think about different things differently. If I hadn't gone, I supervise adolescent programs, and I always emphasize that before we do anything, we should talk about abstinence and then move on. But sometimes you're in the office thinking about wrong things. You need to be responsive. So part of this dialogue is to talk to some of us to caretake or program for young people. It was hit by H-Tone and many other such things. Now, you're surprised how a young girl in Jinja in a secondary school with no phone actually has Desire's picture. That I found very surprising. The young girl had it somewhere, printed. So I was asking, but now where did you get this? I also have it. So that is the power of social media. So as we look at social media, we should have active young people that are aware of the issues, and as they communicate, they are not misleading other people. And we also need to continuously share current and accurate information. We're also looking at building leaders of tomorrow, creating a mass of resources for sexual and reproductive health. At the development level, sexual and reproductive health still to us as RHU remains a pillar, something that we need to integrate in every other aspect of development. There are many young people that have come to the university, but like the panelists have said, as they get out of the university, their life is already wasted. Others go into a verge of responsibility. You find a young person who goes into active parenting in their first year outside university. That limits their ability to grow in career and other things. So we need to create a mass of young people right from the time that they're entering the university, as well as champions in the workplaces where they would go. We want to create a mind shift to think positively about sexual and reproductive health. We do not want to have associations that make us think of only the bad of sex and sexual and reproductive health. We want people to think positively, people to know that it's in their power to make decisions, people to know that there are consequences and that those consequences come as a result of their decisions. So it's about everyone taking care of themselves, making the right choices, and taking care of what they decide. Their decisions belong to them and not anyone else. I would have a lot to say, but at this moment, allow me to appreciate once again. I have learned a lot in this day myself. I learned, in one of the groups I was in, with Dr. Msimenta, she was very empowering. But one of the young people said, until I joined secondary school, even up to now, I'm not very positive about girls. Because my parents told me, girls have caterpillars and millipedes in their skirts. So I actually feel scared every time I see a girl. So just asking, Dr. Matembe shared her experience of the swamp. This is a person in the university today. And I looked at their facial expression as they were saying this. They really meant it. And I'm just thinking, how would someone use that as a tool to protect a young person? And for how long can you protect a person who thinks girls have caterpillars and millipedes in their skirts? What kind of relationship will this person go into finally when it's their time to relate? When they finally discover that actually it's not a millipede, or a caterpillar that is in the girl's skirt? Is that the kind of society we want to live in, based on fear? So to us at RHU, we promote a rights-based approach, and we do not promote having sex, we do not promote irresponsible behavior, we promote information for everyone, we promote active decision-making, and we promote safer sex choices. Thank you very much. At this moment, allow me to invite the chairperson of the board of Reproductive Health Uganda, Honorable Sylvia Sinabulia. You are welcome, madam.
Friends, ladies and gentlemen, it has really been a long day, and I don't intend to make a speech, but allow me on behalf of the board of Reproductive Health Uganda and the entire membership to thank everybody. I want to thank the keynote speakers, I want to thank the panelists, I want to thank the universities which are participating, I want to thank the students, I want to thank the organizations that have worked together to ensure that this dialogue is a success. And I believe you all agree with me that it's very important and very necessary that we hold such dialogues. And listening throughout that day, I wished that we would have the resources to not only to have a national dialogue, but even to have district dialogues. Because we realized that when you wait for children to come at the universities and give them this opportunity to discuss, you have missed a critical stage, because many children begin being active, sexually active, maybe in secondary schools or in primary schools. So it was a challenge, and I believe we need to think harder, scratch our heads and see how we can take this further. We know that the issue of sexuality, the issue of sex is a taboo subject in Africa, in Uganda, but we can no longer afford to keep quiet about it. Because when you keep quiet, the social media has come in and it brings out all sorts of information to the young generation. So we need to be active as parents. We don't have to use the blame game. I know the parents wish their children well, and likewise I believe the children would love to be good children who impress their parents. So we'll do whatever it takes as Reproductive Health Uganda to ensure that these dialogues are sustained, but not only at the national level, but also at the district level, and such that we can open more spaces to have such conversations for the young generation. I want to thank you so much for spending the day here, and I hope that in your other spaces, this dialogue will continue. Thank you so much, and God bless you all.
I can't speak after the chairperson, but Honorable Sylvia, we are so humbled that you've been with us all day. And Alex, I want us to organize a group photo with the chairperson for our own archives at the Youth Center. So, Honorable, we shall go out with the rest of the panels and we shall take a group photo with you. And otherwise, I think the day is over. Thank you very much.
Again, Supremacy songs. Doing it for the ladies, doing it for the lovers, doing it for everyone on this Valentine of fear. You know what it is. Let's go.
Supremacy sounds.
What would I do without your smart mouth? Drawing me in and you're kicking me out. Got my head spinning, no kidding. I can't pin you down. What's going on in your beautiful mind? I'm on your magical mesmerized, and I'm so dizzy. Don't know